the Zoom link?
Here we go, I'm doing it.
Okay,
Start the meeting now.
all right. I think we're good.
Oh, it's not letting me connect, so sorry, I can't do it.
We'll have her do it in a second. All right. We are going to convene the September 15th, 2020 Scott County Board of Commissioners, and we're going to rise for the pledge. But before we do that, it just feels appropriate that we take a moment of silence as an official board to remember 9/11, and by remembering, hopefully we will not forget. So let's just take a few seconds. Thank you very much. Pledge allegiance
To the flag of the United States of America,
and to the republic
for which it stands,
one nation, under God, indivisible, with liberty and justice for all. Thank you so much. Moving on to item number 2, amendments to the agenda. We know we are going to have one. 6.9 on consent is going to be pulled for presentation. So we know that there is that one change. Are there any other changes? And I should also mention that we are full strength. I always forget to say that till this point. We are full strength. We've got Commissioner Ulrich. I'm looking here at this screen, and Commissioner Beard on this screen. They're somehow together out in the cloud. So we are all here, and all votes will be, once again, roll call. So, are there any other changes to the agenda other than pulling 6.9?
Mr. Chair, I will make a motion to approve the agenda then with pulling the 6.9.
All right.
Second.
All right. Deb, will have you take it away?
Commissioner Weckman-Brecky.
Aye.
Commissioner Wolf.
Aye.
Commissioner Beard.
Aye.
Commissioner Beer.
Aye.
Commissioner Ulrich.
There we go. All right. Thank you very much. Moving on to item number 3, approve minutes of the September 1st, 2020 Scott County Board meeting. Are there any changes, additions, or deletions on that?
Mr. Chair, I'll move approval.
We have a motion.
Second.
We have a second. Is there any further discussion on the minutes? Looking at my screens, looking to my left and right. Otherwise, Deb, take it away, please.
Commissioner Weckman-Brecky.
Aye.
Commissioner Wolf.
Aye.
Commissioner Beard.
Aye.
Commissioner Beer.
Aye.
Commissioner Ulrich.
All right, thank you very much. Item number 4, always a highlight, recognition of interested citizens. This is a great opportunity for anyone to come and address the board, either in person or virtually, to address us with whatever may be on your mind, and we will give you listening ears for that particular issue. And I see one making a move. Come on in. Yep, thank you. We believe we're going to have, well, one in person at least and one online, which will be a great test of that system. So come on up. You've got 5 minutes to give us what's on your mind.
Thank you. Thank you, Chairman Beer and commissioners and everyone who is here. My name is Corla Masters. I'm one of the pastors at Shepherd of the Lake Lutheran Church. We're over by the YMCA on 42. And we're a congregation of about 1,000 families who are your constituents. We're also a congregation that has hosted for many years through the Families Moving Forward program. And that program and the Prairie Point development are what I'm here to talk with you about this morning. When I started at Shepherd of the Lake about a year ago, this time last year, we were 3 weeks away from our first hosting week of that year. We've been hosting about quarterly for 5 years at that point. And I have this amazing leadership team. I have a team of folks who are teachers and doctors and lawyers and stay-at-home parents and retired folks and serve this community in so many ways. And one of the ways that they serve and live their faith in this community is by being part of our Families Moving Forward leadership team. And several of them have been a part of it for many years now and have seen kind of the rhythms of what that program looks like. And right as I was starting, one of the things they were beginning to notice and put words to is that things are different now than they used to be, was kind of the language they used. It used to be, they said, that a family will come and maybe be part of the Families Moving Forward program one time or maybe twice, because we host quarterly, and then we would never see them again. They would get housed and they would stay housed. What happens now is that families will be part of the program for 2, 3, 5 hosting times. Folks, that's more than a year. And my folks wanted to know what that was about. They wanted to know what was shifting in the landscape of housing in Scott County, in this area, that was making it so that their own neighbors were not able to find housing and keep it. The other thing they were noticing was that families used to get housed and then stay housed and not come back. And now families might get housed and be gone for a quarter or two and then come back because they lose their housing. And for them, what they really saw was a need for expanded affordable housing specifically for families in this area who need it. They have begun to recognize that the time is now to support both families moving forward because the need has not stopped for emergency family housing, and to support something a little more long-term. Something that could support the families that they were seeing in and out of this program to get stable. These are families with kids who are already living here, who are already in the school districts, parents who are already working in this area, who just need a place to land and to have enough support around them to get on their feet. And so I'm here this morning asking you to fully support and fully fund in your 2021 budget both the Families Moving Forward program and the capital commitment to the Prairie Point housing development. And I believe you're going to hear from one of my colleagues, Mr. Tom, as well this morning, digitally. But I am here as a pastor in this area whose members are your constituents, who are asking why this has not come to be yet, and who know that the time is now. Thank you.
Thank you. And I'm going to ask you a question.
Yes, sir.
We don't normally do this, but you and I and a couple others had a meeting about a month or so ago, and I hope I'm not speaking on a turn and
No, sir.
if this was any sensitive data. Well, did you find a tattoo appointment yet?
I did. October
Okay, good.
17th.
Okay, that's, and the second one, you had mentioned in that meeting that your congregation, Shepherd of the Lake, had kind of put up, dedicated some funds to go, and I think that's something that should be celebrated.
Yes, sir. Thank you.
So is that
I
something-
agree. So the ways that we've participated in Families Moving Forward and in Prairie Point in the past has been mostly as a hosting site. And we're moving into a point of closing out one capital campaign. We're going to take a year break to kind of breathe and assess where we're at. And then we have another 3-year capital campaign. I'm also not telling anyone anything that's not public right now. I'm not unveiling anything. And as part of that capital campaign, our church council has been really, really supportive of being part of this project, right? We know that it can't be done by churches alone. We know that it can't be done by government alone. This is the kind of thing that, this is a county we talk about live, learn, and earn. That's everybody's business, right? Those 3 things touch every part of a community. And so it's going to require buy-in from churches. It's going to require buy-in from the government. And that money, the amazing thing about this capital ask, particularly for Prairie Point, is that $900,000 over several years turns into an extraordinary amount of money through the way that Beacon has worked on their projects in the past and plans to work on their projects now. So there's kind of a beautiful thing, and one of the ways that they do that is through working with other congregations like ours to put significant commitments. Like the county, it'll be over a few years, and then also to do some internal fundraising, because we know that folks put their money where their priorities are, and for our congregation, their priorities are in housing for families in this area, for folks who are already their neighbors, already their kids' classmates, already their coworkers, who just need a home. So thank you for
Yeah, no, I think
giving
that's
us that little
important
boost. I appreciate
for
it.
everyone to kind of hear that.
Thank
Thank you very much. And now I think we are going to go online. I'm looking at Deb or maybe we're going to have a in-person, but we believe there is still one more. I don't know if they're on Zoom or if you're out there in the digital world.
Good morning. My name is Tom Francis, and I'm an advocate for Beacon Interfaith Housing Collaborative. My support of Beacon is the result of witnessing excitement of families in the Families Moving Forward program. After months in the program, have finally found permanent housing, and in touring immaculate Beacon supportive housing facilities and seeing residents with spring in their step and vision for the future in their eyes. All the while knowing that my family was nearly out of options at one time. It was early spring 1984. The U.S. economy was in the second year of a significant recession. I enrolled in unemployment benefits. Although I worked harder trying to find a job than I did while employed, the agency questioned if I was doing enough. All of the job leads provided by the agency were pursued by hundreds of applicants and a waste of time. I searched the want ads and sent out broadcast letters to dozens of companies, but few were hiring. There was no internet at the time, so job leads were more difficult to find. After a couple of months, it really got discouraging. It felt as though I was failing as a father and provider for our family. I was a hard-working guy with multiple capabilities and asked myself, why doesn't somebody hire me? I took a part-time job remodeling someone's basement for cash just to make ends meet. We were conservative with our money and had about $1,500 in the bank when I lost my job. I found full-time employment 3 months later. Our savings was down to $500. Karen or my parents would likely have helped us out if we ran out of money, but that would have added to the humiliation. Thinking back, it makes me contemplate what desperation I would have felt if I hadn't known our families were there for us in case we failed. I've come to believe in a society that has a safety net for those in need without options. I believe that Beacon's Families Moving Forward program and construction of supportive housing, including Prairie Point, are part of that safety net. As a 30-plus year resident, taxpayer, voter, and person of faith in Scott County, I urge you to support a $900,000 capital commitment to building Prairie Point. Thank you for your consideration.
Thank you, Tom, very much for joining us via Zoom. Appreciate your heart on that. Is there any, I want to make sure that we're not, I don't think there are any, but if there's a way to see if there's anyone else out there in digital land, I'm not seeing anyone else. Otherwise, we are going to move on to item number 5. We're going to receive information on Scott County Delivers topic, work to end child abuse and neglect. Together we can. And we're looking in a room. We've got a few folks in person, and in Zoom land, we've got quite a few more. So looks like Chris is wanting to kick this off. So good morning to everyone in the room, and good morning out to everyone in Zoom land.
Good morning, Mr. Chairman, Commissioners. This morning, Brad Davis and I have the privilege of leading a conversation with a large group of folks that have been working together on the Together We Can initiative. And as you know, this is an initiative that you really started. It was part of our last strategic plan, and there was a lot of planning and sort of raw beginnings at that time. And then when we reviewed and updated the strategic plan, it took more shape, and you continue to support the work of this initiative. It is really one of our strongest examples of innovative practice. Like, is there a way we can take our existing programs and work differently? And you're going to hear a lot about working differently today. It's the first time that we're here to do a formal update to you on the progress on this strategy. It is too early for us to connect dots that says this work leads to this change in data. But what we are going to talk to you about are what are the markers that we're looking at in the community that tell us something about if this work is effective over time. And so we're going to talk about high school graduation rates and third grade reading levels and screenings and connected kids and all those things that you pay a lot of attention to as we come forward with Scott County Delivers presentations. There's kind of 4 themes you're going to hear. You're going to hear a shift from reaction to prevention. You're going to hear a shift from how we engage with the community, that this is a different level of community engagement. You're going to hear an expansion of nonprofit partnerships and offering families choice and offering them alternatives to service beyond government programs. And you're going to hear about partnerships leading to change. And I have really pushed this group as we have talked about collaboration is so important, and this is a very relationship-based community, and we value that. And we also want to see results. And so let's talk about what are the changes that we're making as a result of these partnerships today. So I'm going to start with some introductions. Brad and I are going to lead the questions. We'll leave about 10 minutes at the end for questions from the commissioners, but we also just invite you to jump in. This is a topic that we know you're really knowledgeable about, so jump in as you wish. And I'd like to start with, we have a good mix of folks. We have 3 presenters in the room. We have 5 remote, kind of a nice mix of county staff and private partners. I'm going to ask to start with Suzanne Arnson because she also has some acknowledgments to make.
So good morning, Commissioners. Thanks for having us today. I'm Suzanne Arnson, the Child Welfare Manager. Before we sort of move on with introductions, I do want to do a special call out. On the Zoom line, we have 2 pretty critical partners that I want to acknowledge who have not only supported us through funding, but also through partnerships. And so we have Mike Scholl from Casey Family Programs. And Casey Family Programs and Mike have been active in really supporting our efforts to move interventions upstream and focus on prevention. So wanted to just acknowledge that Mike is on the line and appreciate Casey's support. And then the other person is Colleen O'Keefe. And Colleen is from the Sauer Family Foundation out of St. Paul. And the Sauer family has been generous to support some pilot work within child protection through funding, as well as really, again, partnership to talk about how do we vision and potentially transform child welfare to a more prevention base. So I just wanted to do those 2 call out to some important partners.
I'm Vicki Wilbur, the Child Protection Workers in Scott County.
I'm Mary Kay Stevens, Public Health Supervisor, Scott County Public Health.
Let's see. Heather, would you introduce yourself, please? Heather, I'm going to ask if you would turn your volume up for us when you get a chance. Tamara, would you introduce yourself?
Hi, I'm Tamara Stevenson with St. Francis Regional Medical Center. I'm the manager for mission and investment engagement.
Thank you. Lisa Welter?
Good morning, my name is Lisa Welter. I'm the Safe Families for Children National Leadership Development Director.
Thanks for joining us today. Melissa?
Hello, Melissa Gardner with the CAP Agency, formerly Crisis Nursery Manager, currently the Associate Director of Prevention Services.
Thank you. And Jake Grusing.
Good morning, everybody. Jake Grusing, Scott County Library.
Thanks for being here, Jake. All right. Brad, I think you and I are going to share this microphone this morning. So maybe we'll just start off. And I would like to, it works best, I think, in this remote environment, if we can kind of go through the packet a little bit sequentially. So we're going to start with some questions on that upfront narrative. And so I wanted to first throw out a question about on page 3, there's a list of protective factors. And I'm wondering if you could talk about there are other protective factors listed in the data later. And so I'm just wondering if you can talk about the research around these protective factors because they come up throughout the material.
I think we'll have Heather maybe dive into that question.
Okay.
Sure. So, can you hear me okay? Sorry, I lost my voice yesterday and it's just coming back. Can you hear me?
Yes.
So the family protective factors is framework that comes from the Center for Study and Social Policy, and it's framework that has proven to reduce child abuse and neglect. So as you build these concrete supports, which are meeting the basic needs of families, so housing, food, child care needs, and the knowledge of parenting and child development. So we know that child well-being is directly related to parental well-being. So how do we support parents really understanding ages and stages that their children will go through for healthy development? And then how do we build resiliency in parents? So when they struggle, when times get hard, if there's a global pandemic, how do parents have that resiliency and that support and time for themselves and self-care to manage themselves and their children? then looking at social and emotional connections of children, it's how are we helping support children in growing up attached to adults? How are we supporting their attachment and their emotional connections to not only their parents, but other protective adults and family members in their lives? And then those social connections, how are we building a network around families? So many of us, I think in Scott County, are lucky enough to have family supports nearby. But some of our communities don't, right? So how do we really provide those social connections and interactions through our districts, through our faith communities, to wrap around families and support them? So these 5 family protective factors are really evidence-based in preventing child maltreatment.
Thank you. Can we look at page 4, please? And on page 4, there's a list of expanded continuum for prevention services. And I wonder if someone could talk a little bit about what are the new features that have been developed as part of the work of this initiative. So some of those are organizations that have been in Scott County for some time, some are new. But what are the new elements that you would attribute to the work of Together We Can?
I can maybe start us off and then would certainly invite other panelists to join me. Since we've really talked and launched Together We Can, we have been able to formalize a partnership with Treehouse around supporting youth having access to youth support groups, as well as individual mentoring in 2 of our communities, New Prague and Savage Prior Lake. And Treehouse, just this summer, we launched a partnership for them to focus on providing increased supports and mentoring for children who are likely to age out of the foster care system. And so again, that's a new partnership. Safe Families for Children, we are just actually launching a new partnership now. We really see that as an upfront prevention-based partnership where families can access mentoring, supports, and we're even certainly doing some exploration of support around virtual learning for families, given the current environment. So that's a new partnership that we, again, have just launched. Some additional work that we've done with the Catalasso group around circles. And that really is a restorative justice practice where we are talking about how do we help families and systems engage in conflict resolution in new, more innovative, and really peaceful ways. And so we are looking to bring training here. We had intended pre-pandemic to do an in-person training this summer. We have postponed that to early 21 to reevaluate based on sort of where we're at with the pandemic. We've also launched a formal partnership with St. David's for Children to do some evidence-based parenting skills for families involved in child protection. We are also working and have redefined a relationship and contract with NAMI. Historically, they have provided some community-based support groups, although given the pandemic, we really needed to sort of shift because of the not meeting in person. And so we have NAMI who's really doing outreach services to families with children who may have emotional behavioral challenges. And then as part of the Together We Can, those subcommittees are actively engaging with different providers around peer recovery services and what it would take to bring peer recovery to Scott County. So are there other folks? Mary Kay, maybe I'll pass it to you to see if there's additional comments.
Sure, I think I can comment about some of the collaborative work that happened between our internal systems to some degree with child protection and public health. We've
Mary Kay, can you use the microphone, please?
Yep.
Thank you.
We've adopted some additional protocols and practices so that we're working more collaboratively and upstream with families. For example, if child protection reports come in that are screened out, we have an opportunity to offer some supportive services. If a report comes in about a parent with substance use during pregnancy, we have both a nurse and a social worker reaching out to them to offer some connections and support to move forward in a positive way in some of those things.
Suzanne, could you, I noticed you had the Beacon one listed there. Can you, and they just spoke to us, some supporters. Where is that at, and what are the discussions revolving around that right now?
So thanks for that question, because it's sort of like hot off the press. So Beacon, there is a current grant that has been, or RFP that has been released through Corporation of Supportive Housing. And it's specifically a housing program for families in the child welfare system. And so last Friday, Beacon and Volunteers of America and Scott County had a very preliminary conversation on, is that an opportunity that Beacon is interested in considering as part of their planning around Prairie Point. And so I think it really is, we have invited Beacon into the Together We Can work, both to look at, again, what can that Prairie Point site offer in terms of additional supportive services aimed at prevention, and how do we integrate and begin to plan collectively for that over the next 12 to 24 months.
Thank you.
All right, Nikki, can you tell us a little bit, well, let me ask one other question first, sorry. How, could somebody talk, maybe somebody from one of the private agencies, so there's a lot of people, there's a lot of work, there's a lot of these new launched partnerships. How do you mobilize this to get things done? Like, how do you mobilize this to meet needs?
This is Tamara. I would say one of the things that has been different with Together We Can is actually having a staff person, like having some infrastructure there, like that's how. Like there's so many collaboratives around, and I feel like one of the things that has been different here is that it's helped us move so quickly from ideas and models into saying all different people at the table, you know, we're really, you know, level setting, having new people at the table, having people who aren't normally there together, that has made a big difference. But having someone whose role it is to kind of move the work and, you know, and keep us moving forward, I think has been a big help too.
Nice, thanks. Do you have examples of things your group has accomplished together because you had all those different voices at the table? Does somebody want to talk about the United Way grant?
Yes, absolutely. Melissa with the CAP agency here. I can talk a little bit about our United Way collaboration. And so back in April, a grant came out through United Way that was offering direct supports for families in the community. More specifically, families that may not be eligible for a lot of the stimulus funding or enhanced unemployment, things like that. And we pulled together a team with Together We Can and pulled in some other partners, including Southern Valley Alliance, that works with domestic violence victims, as well as a new partner at CAP, Esperanza, that's been doing just amazing work with their food distribution in the community. And we applied for this grant as a collaborative, and were awarded $40,000. And so that is $40,000 in direct service funding that is going, and it went out faster than I could even keep up with it. The funding helped 46 families directly with cash assistance, which was part of United Way's rules around how we wanted to get this money out to the community. We have helped 46 families with cash, 11 families with rent assistance, as well as Southern Valley Alliance, where it was able to help 12 families that were suffering from domestic violence issues, which we've seen a big spike in since COVID. And in addition, a big chunk of that support went to fund some of that food distribution that we see in the community in partnership with Esperanza. And so, you know, I think, you know, the biggest thing I can say is that if we had applied just as a CAP agency, there was a cap of $20,000. But as a collaborative, bringing in community partners and sharing in getting the resources out there, we were eligible for much more and twice that amount. And so, you know, we definitely prioritize families involved with child welfare. And so, families, or child welfare workers at Scott County could reach out directly to us with the referral process that kept clients' information confidential. And we were really able to get that money in the hands of the families that needed them in the moment. And it definitely made a huge impact. Last week I was out at a food distribution at Esperanza, and I connected with one of the volunteers there, and she was able to just tell me several stories. One of a family who had a car payment due, and they were so panicked that if they didn't make this car payment, it was going to get repossessed, and the domino effect, right? They were going to lose their job, which meant they were going to lose their housing, and when they were provided this cash, it went right to that car payment, and the family was just in tears and so appreciative. As well as another family with a rental assistance situation where they truly felt like they were going to be homeless, and without that support, it wouldn't have been possible. And so that United Way grant funding went fast. We've got a little bit of money left over for additional supports and supporting some of our overnight stays for families, but it really was a great partnership and would not have been possible without the work of Together We Can.
Thanks, Melissa. Nikki, can you talk about how is this different for the families that you work with every day, or how is it different for you as a worker in this environment?
I think it's been different as a worker to finally to see that like the community coming together to help people and taking responsibility for kids that may be abused or neglected. It hasn't been solely the responsibility of child protection, and I think that's changed even from the first meeting. That absolutely the communities, kind of schools, hospitals, clinics, everybody has kind of come together to figure out what they can do to help prevent child abuse and neglect. And I think for the families that feels different. Because it's not such a punitive system, when you feel like you have the whole community standing behind you wanting to help versus you've done something wrong and now you've been assigned a child protection worker.
Right. Thanks. I wanted to ask just a couple questions about COVID. The documents reference a lot of things that are put on pause because of COVID, but I'm wondering if there are things. Are there any improvements, are there efficiencies or adaptations that have come out of COVID that you might hold on to as a child protection worker?
Yeah, I think certainly it's helped connect with people in a different way. I think it's also helped us look at connecting parents to their children in a different way, especially children in foster care. By using, Skype or Zoom meetings, all of those things I think help clients feel a little closer to their kids. At times there wouldn't just be a visit, but it could be like putting kids to bed over Zoom or eating lunch together. I think that that's also helped us connect with clients. I still have done most of my visits in person, but I'll find like clients mostly now when I call them, they want to Zoom instead of just talking on the phone. Like I think it just makes people feel a little more connected that way.
So are those some things that you'll continue?
I think a lot of those things we will continue, yes.
Brad, do you have narrative questions? I'll step aside for a few minutes.
I think what impressed me the most when I read the packet is the rich amount of data that has been collected. And so I just have a few questions on some of the data and the snapshots. What impressed me is how there's data across decades for a lot of these measures. And I think that's important when you're dealing with this topic and see how interventions might be changing the trajectory of some of this data. And so there was a couple of snapshots that caught my eye. It looks like there's a swing one way or another, and I'm just wondering if we could talk through some of those. One is on page 18. This was one that caught my eye. You have data across 7-8 years here, the rate of children who are subject of maltreatment. And I'm just wondering, when I see the increase in 2018 and in 2019, if we're looking at truly changes in rates, or are we looking at changes in definitions or reporting, or what that could be?
So thanks, Brad. Good question. Certainly we saw, so there were some pretty substantial child welfare, child protection changes that came back in 2015, 2016. And what we saw from that, if folks remember Governor Dayton's task force on the protection of children, it was in response to certainly a couple of very tragic child fatalities. And so in response to that, there were 93 recommendations that really changed the landscape in many ways of child protection in bringing more families into the child protection system. There was concern, certainly by some, around screening criteria and how many cases may have gotten screened out. So we saw a broadening of criteria, and so in some ways I think you're seeing changes in the system that have resulted in more families coming in. From a practice, I don't know that we have changed practice other than to respond to changes in law.
On page 23, that was another data set that caught my eye in terms of seeing the sharp decrease in the percent of children enrolled in child and teen checkup. When you look at the trend lines from going all the way back to the first part of the decade, just wondering if there's any reason why you see the drop in the last couple of years on that data point.
I can take that. So I think there's some things that point to that perhaps with the way that healthcare has evolved, that there would be more kids who would be eligible and covered. This is a program that's for kids on medical assistance or Minnesota Care. However, I think one thing that may factor in is sort of a climate of how people feel about accessing services and things, and some barriers and challenges that may be created there.
Can you speak more to that? What are...
Well, of the population that's eligible for child and teen checkups, there are some that may have less ability to access or feel less comfortable to access governmental supports around healthcare. It can be many things such as transportation or moving around a lot and things like that that are more the barriers around actually getting in for those well checks. But I suspect that the drop is, and I should say the disclaimer is that I don't work directly in this program, so happy to get further data for you about that, but that as families are less comfortable accessing supports just because of political environment or barriers that are in the community, that gets in the way of them accessing these programs that help make sure kids are on track and getting in for their care.
Can I ask, do you think, because a couple of years ago, it seems like people started worrying about all these vaccines and stuff, like they were carrying some sort of chips and stuff, that people didn't want to go get them anymore. Is that about when that happened, or is that, am I thinking wrong?
I think that you're talking about people who are cautious about
Adverse
vaccination.
vaccines. You know,
Exactly.
some populations, because I remember like a couple, it's been on the internet or on the Facebook or whatever, so.
It could be impacted by a growing
Some fears.
concern about that.
Yeah.
However, there are many options in healthcare around providers who have different perspectives or work with families around those things. And so I would suspect that if vaccination being just one piece of that well child care, that families would still continue to take their kids in for checkups and things. But it could also be a factor.
All right, I have one other data-related question before I'll turn it back over to Chris. And it's a question for the entire panel, but I'll use slide number on page 30 to frame up the question. What I liked about the graph on page 30 is it looks like we're looking at a couple of variables that impact proficiency in reading and math in third grade. And so it's just an interesting set of data to kind of think about. But my broader question is, it looks like we might be seeing a result of some data sharing that's happening between a couple of data sets, perhaps, of reading proficiency and those that are involved in child protection. And I'm just wondering for the entire panel, how is data sharing going between agencies, between efforts? Is there still some obstacles in place where you wished you were able to get more data or better data from other agencies in order for you to show the progress of your work?
Thanks, Brad. I'll maybe give us a starting point and then others can chime in. In terms of the data sharing question overall, Brad, I think there continue to be challenges. This data on page 30 is the result of some data sharing between the Minnesota Department of Education and the Department of Human Services. So there's agreements across those state agencies that allow aggregate. And so this is information, again, from state agencies regarding, again, the intersection of kids in our child protection system and then education achievement. In terms of local data sharing, I think it continues to be a challenge. As Scott County and Together We Can and CAP work in partnership, certainly I think some next evolution in those conversations are how can we take a look at perhaps information sharing to begin to examine parents helping parents, and is that support group helping keep families out of child protection? But that gets into then obviously confidentiality in the exchange. And so I think there are opportunities for visioning out what would need to be in place around data sharing, but continues to be a challenge. Any other panelists have input?
I would just add that I believe public health is pretty close to a data sharing agreement with Shakopee School District to better support young children and families as they move through the education system.
So let's keep talking about education for a minute. I'm wondering how this team's work aligns with Live, Learn, Earn.
So I can speak to one piece of that. In public health, we've been in prevention work for a long time. That's really our thing. It's been amazing to see how so many community partners have come together around this. The whole community really mobilized. There are new faces at all of these kinds of meetings, such as Live, Learn, Earn, who'd been taking a focus of a sub-slice of that, for example, in the educational preparedness group. And so some of that work has started, but then it's really launched into other community people owning it and participating in it. For example, it brings together some of the work we're doing in the B25 group that has started. We've got new faces and players there. And also some of the community health improvement collaborative work that happens through public health too. But it's just been expounded based on the Together We Can work. And I think one key piece of that, as has been mentioned already, is having someone who is dedicated staff time to really foster those relationships in the community and keep that moving forward, and then bringing us all together in our work.
Are there initiatives within your group or strategies to promote things that we think are good for kids, like immunizations or preschool screenings, or like are there active efforts within this group to support some of those data elements that we look at? Ooh, sorry about that.
I think there's, I can have maybe Heather join in a second around some of her work to across Live, Learn, Earn as a way to, I think, create bridges and integration rather than duplication of efforts. I will say, just as a sort of a concrete example, the board will have an opportunity to hear later this morning about a grant proposal we're interested in applying in. And part of that discussion is the interest of how do we make preschool screening more accessible to families really across the community. And so one of the potential strategies is, as part of the grant application, is to bring in preschool screening to these community hubs. So just kind of a concrete example of how we're taking different pieces from different initiatives or groups and try to build those together.
Okay. I also had a question about, there's information in the narrative about kind of this two-generation approach, and we believe kids are going to do better if their parents are doing better. And so when we look at education and literacy, are there supports for parents? Like many of these parents probably have educational gaps of their own, right? So are there supports for them as we support kids in the literacy development or literacy-rich environments?
Heather, do you want to jump in on that?
I was actually going to invite Melissa and or Lisa to talk about our partnerships with them and how they're supporting parents.
Absolutely. I can talk a little bit about the, Parents Helping Parents and the work that we're doing through Together We Can. And so, you know, more specifically, really supporting the families that we serve and supporting their unique needs has been a priority for us. And so through Together We Can and the partnership that we've created, our plan is to start a group in Jordan in person in the spring, but in the fall we're launching more of a virtual option for families, which will include a Spanish-speaking option, which I think is definitely needed in the community. And through our partnership with Esperanza, I think will be very fruitful, given that we've got those referral partners that can really bring in that audience and help us with that outreach. And so, you know, I think one of the things that we see with a lot of the families in Parents Helping Parents is kind of a benefit or a bonus to the program that we have is that families who are learning English are practicing their English. And so we've had several families that say, this is the one place I get to come each week where I can practice my English, and they really appreciate that. And having that support. And in addition, we, you know, bring interpreters in where it's needed, but also know that there's a need for additional language options for families. And so we're really excited about that new opportunity out in Jordan to create that Spanish-speaking group.
Nice, thanks.
I can follow that, Melissa, thank you. Lisa Welter from State Families for Children. One of the hallmarks of State Families is providing wraparound support to parents and their kids. So this two-generational approach it works very well. We primarily recruit through the faith communities so that parents are mentoring parents, and through that we do family coaching. And so we really are able to customize our approach and meet the needs of the parents and also the children, but we do that through that community lens, primarily through the faith communities.
Thank you. Jake, did you have anything?
I would add more broadly, since COVID, I think Together We Can has really shifted in our outreach. So we have a list of over 320 families across Scott County that we're reaching with supports around those 5 family protective factors. And so it will be supports for parents about here's what you need to do to support your 3-year-old tantrums when they can't see grandma. Or here's some Scott County resources where you can access food. And so I think by getting that information into the hands of people, it's also been super helpful in a time where what we need more than anything is those relational connections, and we can't have those in person. And so how do we support resources for families to access those virtually?
Jake, did you have anything to add around the parent, like supports for parents on the literacy piece and the literacy-rich environments and creating that for your children?
Yeah, I do. Thank you, Chris. It's obviously hugely important, right, for everybody, for all kids, to make sure their parents, their caregivers are engaged in that child's healthy development. And I don't think anybody would be surprised, like when there are ACEs present in the household and kids are getting, you know, placed out of their homes, nobody would be surprised that it's hard for them to focus on school or their 3rd grade reading, you know, any of that stuff. I would like, if I can, just to say one other thing about Live, Learn, Earn, and its relationship to the Together We Can work. Yeah, Live, Learn, Earn broadly looks at transportation, housing, workforce development, which includes some post-secondary education, and the educational preparedness. And I think without ever being probably as explicit as we could be about it, we always return at Live, Learn, Earn to the reality we're trying to respond to, which is the issues in people's lives don't fall into neat buckets that align perfectly with existing programs. So I think there's a belief there, and it certainly shows up in everything Together We Can has been doing, that our solutions need to be as integrated and as accessible as possible. And you can measure success by how fast and how far we move some of these needles in community indicators and the data that we have in the packet, but you can also measure it by the collective willingness to keep taking that next step together. And Together We Can, Live, Learn, Earn, I think both have done a pretty good job continuing to bring people to the table. And it doesn't always show up in the box score. I've always thought of Live, Learn, Earn. I'm a basketball guy, like the pass that leads to the pass, that leads to the basket. You don't get an assist for that if you make that first pass. It doesn't show up anywhere, but it was the right thing to do, and it led to the right play. And I think Live, Learn, Earn does that, and stabilizing some of those big systems that have a huge impact in people's abilities to care for their children. So it doesn't always come through, it's not always clear, but I do believe it's there in Live, Learn, Earn's work, and I think part of that idea is there for how Together We Can operates as well.
Thank you very much.
Jake, this might be even a little premature, but you and I quite often talk about discussions, right? And the importance of just talking and how that leads to connections. We have a potential connection coming up from a private donation. Do you just want to hit on that a little bit and potentially what it could do for 3-year-olds? It's not finalized and it's going to take a partnership, but just a little background, what we're trying to work through.
Yeah, so again, just the importance of talking about some of these issues over and over and over again. Sometimes whether people want to hear about them or not, they start to land in a different way for people. So we have a couple people in our community who have stepped up in a really, really big way. We're going to bring it to the board in a couple weeks to make a significant donation to pilot a project in partnership with Amazon to get some Kindle Fire Kids devices that will be pretty locked down to just reading educational applications. And we're working on partnering with one of our local school districts to get those out at the early childhood screening, that maybe those could be an incentive to bring your child in to get screened at free. If you do that, you'll get a free tablet with full access to Amazon's early literacy resources. So I think it's one more small thing, and that's one of the best parts. You know, we've talked about this before here, that there is no silver bullet, it is that silver buckshot. That's one little thing. People in the community stepping up, making a donation, saying, we'd like to find a way to try something like this and see if it helps. It won't be the solution, but it's intended to be part of the solution. So I'm excited to see more of those details come together and to bring more of that information forward to this group. But to Leslie's point, it's all about continuing to talk about these things and always making additional room at your table.
Can I just jump in on a second to piggyback on, I think, what Jake was talking about? I think in some ways that it's again difficult to figure out where it fits in the data, but there's a different movement around this idea of breaking down silos and moving away from sort of turf. I think in years past, if we look at how do we bring in services, right, because funding can be limited, there's this protectiveness of, but this is sort of mine. This is a whole different, as we bring in partners, it is really looking at how do we bring in partners that complement each other, that we're not in competition with each other, but what are the needs and gaps within our community to better serve kids and families, and then how do we create the pathway for anybody who wants to come to the table to serve.
Thanks. Can we talk about, both Jake and I think Mary Kay referenced the ACEs data that's on page 32. Can we just look at that for a second? So I wonder, Mary Kay, if you could just give us just a quick, just super quick refresher on ACEs and what that means and why it matters to looking at kids' health and education and development.
Sure. ACEs, adverse childhood experience, are those things that we know from research, if kids have experienced them, have increased their risk for health problems and the kind of challenges that may get in their way in long-term success, particularly if they have toxic levels of stress or trauma, those kind of things. We know there's some physiological impact of that, and school impact, school success impact, those kind of things. So what this chart is showing us is on the left side, you can see, this comes from Minnesota Student Survey data. So on the left side, you can see that kids have designated these types of things that they have experienced and to what degree. And so you have a comparison of what that looked like for 8th, 9th, and 11th graders in 2016 and what that looked like for 8th, 9th, and 11th graders in 2019. So you can see the higher the rates of ACEs, the more, I think that's actually in one of our later charts, where it talks about how the accumulation of those risk factors really increase the factors against that. So the thing we do in buffering that, which is throughout here too, and we've been talking about today, is not just prevention of adverse childhood experiences, but also promoting protective factors. Again, our list of protective factors at the beginning, connections with caring adults, decreasing these types of experiences, but also building skills and connections in people so that they're able to weather challenges of life and buffer some of those negative health and functioning factors down the road.
So then building on the data that Brad was looking at earlier on page 30, so is that surprise you that kids in child protection, who you would presume have some additional exposure to ACEs, that they're performing less well than their counterparts?
No, not at all. In fact, third grade's often looked at as a measure of how that foundation has been laid. There are some studies, if you look at it from sort of the opposite side, not just about projecting what they'll look like in the future, but we can look at some studies about kids' experiences and what they look like at third grade related to their early foundational years and their level of ACEs. So
There's some new research, I think, coming out, and it's sort of a newer conversation. So we hear a lot about ACEs, but we can also talk about sort of the reverse end of that continuum. Protective factors are really this idea of positive childhood experiences, or PCEs, because we like acronyms. But Dr. Bruce Perry, sort of internationally known child psychiatrist, has done a lot of studying on trauma and how do we, again, mitigate the trauma that kids experience. And that really is, how are we looking to create increases in protective factors? How do we wrap networks of support, healthy caring adults around kids and families to help, again, weather or mitigate the perhaps abuse, neglect, trauma that kids have experienced?
So I wonder if we could take, if everybody, and I'm going to ask you to be succinct, but to speak to one piece that we haven't talked about yet that you think has been really strong in the work of Together We Can, and one piece that you'll be working on going forward.
I think for me, the one piece that I think has been very strong is the community involvement. I think moving forward, like, COVID has certainly impacted some things, but two of the big things that I think we've tried to engage is schools. And obviously at this point, schools just can't take on what we're doing with COVID. And I think in addition to that, we've also tried the circles training. And I think our idea had been to engage like the retirement community in supporting families. And I think that's another thing moving forward that would be beneficial, and Together We Can.
Nice, thanks, Nikki.
In terms of what has gone well, I think this is really the first time I've been with Scott County and going on 23 years that child welfare has intentionally engaged in prevention work, and prevention coupled with community engagement. So I think that is both exciting and something that has gone well over the last 18 months. From where do we want to go? From more of a practice standpoint, there is active work being done across metro counties and the state to look at perhaps how do we divert families from entering the child protection system. And so I would hope if we were to be back here in a year that we'd have some updates around the potential for legislative change around that. And as I mentioned earlier, I think continued conversations around integration of data.
Thank you.
I think I've been most excited about the relationships we're building. When you think about what we do one-on-one with families in some of our programs, and you think about what we want for parents, and you think about what we want in our communities and people's connection to the community, it all comes down to relationships. And I think there's been so much work in developing the kinds of relationships at a system level that mirror that and support that, which only benefits the families. So that's been really exciting, and just broadening that community participation in that has been great. One thing for the future that I'm interested in is hearing more voices of parents, engaging parents about what is helpful to them, what do they want. Their voice is probably most important of everyone at the table. So some work around bringing them in additionally.
Thank you.
One thing,
No, go ahead, Melissa.
I just wanted to talk just briefly about, one of the things that Suzanne brought up is breaking down those silos and figuring out, who needs to be at the table. And, we brought in Treehouse, as part of the collaboration, and they are offering, support groups for youth in our community. And I can't tell you enough how big of a support that's been to the families that we serve. We serve families in crisis nursery through age 12. And so after they age out of our system, we're not able to provide that ongoing support. And so the Treehouse Collaborative has been just a blessing, and was actually something that I was looking for before this partnership was created in terms of referring families. And I did have a very successful referral for a family that we were working with as well. And I do echo Mary Kay's sentiment on the parent leadership piece. As we transition Together We Can over to CAP, and we increase our steering committee and add people to our steering committee, that's definitely going to be a huge priority for us to get parents to the table. And at our last community advisory meeting towards the end of last year, we were able to have some of the parents from our parent support group come to the table and really talk about their experiences as well as the gaps in community services.
If I might be able to speak to this as well, I just want to acknowledge how special this is. Whatever is happening in Scott County is really remarkable. Safe Families is in 15 other counties, and Scott County intentionally reached out to us and involved the faith communities. And we had a really exciting exchange back probably about 7 months ago, right before COVID hit. The county had some challenges with finding foster homes, and so they brought a team of us together, and we shared our network and our resources with one another. We designed a presentation together, and then we called out to the faith community and those that we knew to just be aware of what the challenges looked like and how to come alongside foster kids. It was beautiful to watch, and I will say that I have never seen that in action across all the other counties that we're serving in. So I just want to give kudos to the work happening.
Thank you, Lisa. Heather, did you have anything in terms of things that you're most pleased with or work going forward?
Absolutely, and I think during previous discussions, I could talk for several days about how much.
How about we pare that down a little bit?
The way Scott County comes around families to support them, right? I think for me as a facilitator or coordinator, the biggest thing is really coming to consensus. We have so many different partners, and there's shared ownership. There's shared ownership in the end goal of ending child maltreatment, which is huge. There's shared ownership in each step along the way. We created indicators and outcomes and impacts that we're hoping to achieve together. I think we've really level set traditional power dynamics. So we have elected officials, judges, community members, parents, social workers, all coming into the same space and having an equal voice in moving this work forward. And I think that's been evident in our community events. I think in our strategies, one of our strategies really started from parents with lived experience saying, peer recovery support would have absolutely helped me navigate the system. And so right now we're looking at partnering with Minnesota Teen Challenge and Minnesota Recovery Connection and potentially other partners to bring peer recovery support services to Scott County. And so by our partnerships with parents and this shared ownership and collaboration, like we are actually achieving these strategies to support families and work across that child well-being continuum of deepen services and prevention services to mitigate some of the impact of that trauma, to prevent future trauma. So I'm so impressed by the work that everyone has done, and so just grateful and humbled to be a part of this work and invited into the Scott County community to do this. And I think moving forward, I just echo what everyone says. I also, part of my data nerdiness, I would love a program evaluator, right? I would love to ensure that we are making direct connections between the data and this work. And so trying to figure out some of those data sharing rules and how to evaluate our work moving forward outside of just implementing evidence-based strategies.
Thanks, Heather. Tamara, what are you most?
Well, I would just say, I would want to acknowledge Heather and her hard work. So as much credit as she gives to all of us coming around, and I do think Scott County has had a lot of practice working across spectrums and across lines. And I think that we're starting to see the fruition of what that means and how you can pull people together quickly. But having that expertise at the table, as this has been a new area for me to learn about, I'll see like, oh, here's a program, and it's like, well, Heather has talked about that before. Like every time I see something, it's something that she has already helped us start thinking about. And what I've been most proud about with this is that this is really hard work, and that people are just seeing that commitment of people in the community. And then getting to these concrete places, steps of action. So just seeing the community come together to do the really, really hard work. And I'm looking forward to seeing it mature. Is kind of the next step. I feel like there's so much in place, ready to go. The data piece for sure is always huge. I'm very excited to see what we can do with the diversion piece and, first-time families. How do we get folks to the right place instead of always going to child protection? So that big shift to prevention, is always exciting, and it's smaller dollars upstream to make a bigger impact later. So.
Sure. Thank you. Brad, did you even?
Sorry.
All right. I think with that, we're going to turn it back to you, Mr. Chairman.
Thank you
Do you
very
have
much.
questions?
I thought maybe you might, yeah.
Thank you. Thank you, everybody. I have the privilege of serving on the Together We Can committee, and I'm probably not the best committee member, but I get there when I can. And it has been amazing to watch so much progress over the years. And I can't add anything to the wonderful things that you all talked about in our community partners, but I want to add a few comments, I think, for my colleagues, for people watching, for taxpayers who still might be like, well, that all sounds really cool and nice, but is that government's rule? Why are they doing this? That kind of thing. I think, for some of us, it's all about, well, kids and families and protecting them and growing them, and that's enough for us. But our job is to really think about those other issues too. And maybe this is going to play a little bit into our other agenda item coming up. But I think if we just look at the dollars and cents, and I see Danny L. outside the room, and the budget, we have to remember that Scott County taxpayers spend many levy dollars on out-of-home placement every year. And if we don't do something, that amount is going to increase substantially. Not because we have, hopefully we won't have more kids going to out-of-home placement, but we know from the federal and state levels that a lot of the money we're spending isn't money coming from Scott County. We're getting that, and the federal administration with Families First has said, we don't want to pay for out-of-home placement anymore. They're giving us this charge. They're saying, government, this is your role to figure out how, and Nikki, we love you and we want to keep you and all your colleagues, but how, wouldn't it be great someday if we had less child protection workers? That's the message we're getting. And if we don't do something, we're going to have a couple $1 million hit in a couple years because we're not getting that federal money. So it is our role to be a convener here. We're so lucky for our great staff and all these community partners who are like, yeah, we'll work to figure this out. So I think that it's important to have that framework in mind when we talk about this. This isn't just nice and feel good. Saves lives and children too, hopefully. But it is very much our role to make this happen, support it, and figure out how to go forward. For some of the other concerns I think that have brought up is everything together we can is doing and talking about. We're acting very appropriately. Families and children, it's voluntary participation. We're hoping that voluntary participation helps so we don't have to do the involuntary action with families. So I feel strongly about this. I felt like I needed to get those comments out there. And, you know, it's hard, I think, whether you're a staff person or a citizen taxpayer, and your area, you might not even think about this, like, oh, the county's responsible for paying for out-of-home placement? Yeah, we are. If you're thinking about roads and bridges, sometimes it's hard to make that shift. So this work, so good to see the progress in the last year, but if we want to be good, if we want to protect children and families and also be good stewards of taxpayer dollar, we need to forward this work. It needs to be on high priority the next couple of years. So those are my comments.
That's it?
That's it.
Wow, that's,
No big deal.
yeah, Leslie.
I just wanted to build a little bit on that, and this is one of your strategies, right? And it was building off your previous strategy, and it was probably only Chris, maybe, and Suzanne and I that sat in here in Child Protection's first Scott Delivers about 5 years ago now, and it was just child protection. And I want to commend you, Suzanne. I am a huge believer, as you know, in breaking down silos, and diversity leads to better outcomes and projects. In your leadership, to have a team like this working together, it's just tremendous. And you are to be, you and Pam and Mary Kay and Lisa Brodsky and those of you that are leading this, congratulations. I can't wait to see where you are a year from now. I told you earlier, this is my favorite Scott Delivers every year. And to watch the change, and I know it takes time, and why didn't it happen yesterday? But it is tremendous to see and to hear, and the support from these other groups, and the breaking down of that silo, and that we own this as a community, and that we are getting private donations and other nonprofits wanting to come and provide grants. It's your leadership. It's just been outstanding. Thank you.
Thank you, Leslie. Certainly, I think it is important to acknowledge, right, that there is a whole group of people, and there are people, this county has been uniquely positioned to bring in partners to help advance this work. And so it is not the work of one person or Scott County individually. It really has been a community effort of mobilizing people who have the same goal of how do we better support kids and families. So thank you.
My question is, was there a little tip that was sent out to everybody to say, hey, mention that 5-letter word, faith? I heard faith a couple times. I'm just partly kidding. Yeah, I'm still kind of formulating my opinion. I probably made as many of you know, maybe chose the wrong meeting to go to once upon a time, which it just felt like a bunch of big government gobbledygook. But I'm giving the benefit of the doubt, so I don't want anyone to think, because I'm hearing some really good things, and I'm not as close to it as Barb is, and but heard a lot of really good things, and but I keep wondering, because words matter, if I'm in the spot where maybe I need some of these services, I'm looking at this logo on the screen in front of me. Wait, I'm not abusing my kid. I'm not neglecting my kid. I need some help, but if I do this, am I now all of a sudden that dad that, and then the bigger part of it, just talking out loud, one of our interested citizens talked about how he was in a hole, and his next line of defense was his family. Didn't need to go there, dug himself out, but it feels like something, and he noted that something had shifted, that the fabric of society, my words, has somehow changed or been hammered, or the screen has got bigger holes in it. So now it's become less of a family is your backdrop. Now we are all your backdrop. And I do believe the government should be a backdrop, a backstop, I don't think it necessarily should be the first line of defense. I know I'm getting looks, but,
I just heard a little different message.
Yeah,
I heard him say, I didn't want to go to my family. There was some shame in that. I applied for WIC. It was a little difficult to do. I applied for unemployment, but I did it. And I believe government needs to be a backstop there to help those in crisis. And the family was also there.
and I'm for that. I'm for government being a backstop. I'm for government being when you get, way outside and you need, some help. I'm for that. I'm just not for like, oh, your ball rolled just a little bit foul. Let us come in and, well, wait a minute. Like, let me deal with it a little bit. And so that's what I'm saying. My opinion is not fully formed, as you can tell. I'm just talking through this transparently. I heard a lot of really, really good things. But there used to be back in the old days, a Home Depot tagline said, you can do it. We can help. We got all the tools, but you got to ask. We got it. And I feel like maybe, and I'm not saying this is it, but government has said, hey, you know what? We can do it. Allow us to come in and intervene. And so I just want to make sure that us as a county, and I heard some of these things, that we're here to come alongside. We're here to kind of help out where needs be and to be proactive so that these things don't end up costing us a lot of money. So I heard that and I feel that. So I want to, make that known.
Acknowledge that, yep.
But I'm just partly wondering of the messaging, if that would help get more people involved. Just kind of talking out loud. Which
You should come to some more meetings.
Maybe I should. Well, I know I did the one and like, oh. Yeah. So again, it's
Melissa with CAP here. I did want to respond a little bit. I appreciate your words, Commissioner Beer, and I think that as an employee of CAP for 11 years, I think CAP is the Home Depot of social services for the community. And so I think that when we're talking about government not being the be-all, end-all for the services, that's the goal here in transitioning the work over to the CAP agency, and has been the goal of Suzanne and Heather from the beginning in the messaging that they put out in the community advisory meetings, in the steering committee meetings, is that we know that government can't solve everybody's problems, and so we want to take a back seat in this and allow the community to rise up, and the community grassroots efforts in this project are just astounding to me. And so, I'm really excited to be taking the project over at the CAP agency. And coming from managing a program called Crisis Nursery for many, many years, I totally understand where you're coming from when you say, families struggle to reach out when, they feel like they're going to reach out and the response is, oh, well, you're a bad parent. And so we're really flipping the narrative with this work that we're doing. And so that's why I'm just so excited about transitioning the work to CAP and really empowering families to speak up and say what they need, as opposed to government coming in and filling in all of the gaps.
One of the things, this is Tamara, I'd say one of the things I have appreciated as well, though, is the opportunity to have these government staff be part of the work. Sitting at the table with Nikki and hearing from a frontline person, well, here's what's happening with the families. Like, a lot of times with collaboration, it's like, well, go do it, or, there was always this thought of, well, the community could own this, or the faith community was supposed to own mental health. Well, you have to have that structure. And so right now, a lot of this expertise sits with people who do work for the county. So having that be part of the work at this point has been really important and very, very helpful. But yeah, I think we are all excited about it transitioning to CAP, and people forget that CAP is not government. I'm sure no one in the boardroom forgets that, but I think that's something that we are looking forward to.
Yeah, and I just wanted to reiterate that, like, I don't want anyone to be like, oh my goodness, this guy doesn't get it. Probably a few people think that. I see someone smiling down here, even through a mask, but
I'm just kidding.
I know. Good chemistry, that's what it's all about. Like, I honestly do believe, in my heart of hearts, like, I'm looking at people in the eyes here, and I don't know, I gotta look at my camera, I guess, but, like, I do believe that we as a county, generally speaking, are equipped and filled with folks that want to come alongside and help people. Like, I believe that.
Yep.
I think it's an exception to the rule that sometimes one of our staff in whatever department it might be at whatever given time is carrying a hammer because maybe they had a bad day and I'm gonna, it happens, right? We're filled with people and we're broken. So, but generally speaking, I have great pride in our folks that we're out about trying to do the right thing the right way. So, but I just wanted to be transparent and candid. This is the time we have this conversation to just kind of, my opinions or whatever, and they're not fully formed, but I'm bullish, always have been, on the things that we are doing as a county, and we try to do it the right way. So I want that message to be heard first and foremost.
Remember, one of your values is, right, innovation and trying new and creative things and learning from the successes and from the failures. And so I think you are seeing a lot of that here today, and there probably will be some successes and failures along the way. But that is, I think, really innovative. And when you heard Suzanne say it's the first time in 23 years, that is huge, right? Because we still do have a statutory requirement to keep kids safe. I mean, we do. I mean, Pam and Suzanne, they have that. You have to do that. And so the big push was to figure out how to be proactive and prevent people from getting deeper into our system alongside with nonprofits and partners. And I think you're seeing that here today tenfold in how they're moving this forward. So
I'm told to look at the chats. I had to move to that screen. I just think, today, the meeting I went to, we had, some hot shots from DC, the director of Equity and Inclusion and Justice, and a deputy director of Equity and Learning. Like, I feel like we're moving more away. We've had different workshops where we talk about inclusion. Like, don't talk to me about the government version of inclusion, big government, not necessarily Scott County. Like, today I heard more about true inclusion when you talk about faith groups. Like, I'm for inclusion just so long as it's the full definition of inclusion, not just the government, again, not Scott County, but just generalization of that. So that's what was a little off-putting a year or so ago. So
Sure. I wonder, I don't want to put words in your mouth, Commissioner, but I did like your point about the family piece, and maybe that, because like knowing the work that child welfare folks do, they're very engaged with families. Family is the first reach out. And so I wonder if that isn't just a constructive piece of feedback for them to think about in terms of messaging. And yes, we're working with nonprofits. Yes, we're working with community partners. Yes, we're working with extended families. It's just a nice point that is probably stating the obvious, and it's important to state the obvious. So,
And I think that's a priority for this board, and I think it's been brought up by, especially Commissioner Beer. I mean, all of us often, and just from my work with this committee, I know families and the family resources and helping families get stronger and more resilient to solve their own problems,
right,
is key and priority. So, but really good reminder, because I think we should keep that at the forefront.
looking left, looking right, looking on my screens. 2 different pictures here. Anything else?
Well, I did send a commercial message through chat, but
Nice.
for fish. You talk about leveraging the community. We have this fish network, and I think it's really underutilized, to tell you the truth. We do meet quite a number of needs, and we have 800 plus partners and affiliates. And I just want to encourage you to think at top of the mind. I could post this to the fish network. This needs to be met right now by the community. So I encourage you to keep doing that. I know you are doing that, but even in greater measure. And thanks for your excellent work. We really appreciate it.
Thank you. All right.
thank you very much.
Thank you, everyone in person and on Zoom.
Thanks, everyone.
All right.
Hey there.
Oh, yeah. Go for it.
Good comments were made. My only comment will be, I had a list of things and stuff to drill down a little bit in item 6.9, and I think probably 7 of the 8 questions were covered during this presentation, so thank you for helping me accomplish on item 6.9, I appreciate it.
All right. So let's move on to item number 6. This is the consent agenda. These will all pass in one motion, and I will, so we knew that 6.9 had some changes and didn't get posted in time to stand as posted, so we already amended the agenda for that. I'm looking for the nod, so we're not gonna talk about that particular one. So I'll read through the other items, and we can see if there's anything else we want pulled. So 6.1, adopt resolution number 2020-140, providing for the issuance and sale of general obligation law enforcement center refunding bonds. Series 2020A- current refunding of Series 2012A in the proposed aggregate principal amount of $16,900,000, which has an anticipated annual average savings of $238,000. I will read that. 6.2, adopt resolution number 2020-141, authorizing entering into a purchase agreement with Minnesota Counties Computer Cooperative, MNCCC, for the purchase of Adobe Sign and e-signature solution using Coronavirus Aid, Relief, and Economic Securities Act funding, CARES. 6.3, adopt resolution number 2020-143, authorizing the purchase of WebEx software using Coronavirus Aid, Relief, and Economic Securities Act special revenue, the CARES funding. 6.4, adopt resolution number 2020-144, approving the preliminary 2021 budget and levy of $33,350 for the Scott County Vermilion River Watershed Special Taxing District. 6.5, adopt resolution number 2020-146, authorizing the purchase of an ImageCast central count to assist in administering the absentee process using Coronavirus Aid, Relief, and Economic Security Act funding, CARES. 6.6, adopt resolution number 2020-149, authorizing Advanced Systems Integration to rescind their bid for the Government Center East-West and Justice Center Audio-Visual Technology and Security Systems bid package. 6.7, adopt resolution number 2020-147, authorizing the Government Center East-West and the Justice Center Audio-Video Technology and Security Systems bid package contract be awarded to Video Services, Inc. 6.8, adopt resolution number 2020-148, awarding a contract to J.L. Tice, Inc. for the installation of a traffic signal system at County Highway 21 and County Highway 91 in Credit River. 6.9 was pulled already. 6.10, adopt resolution number 2020-151, approving the Coronavirus Aid, Relief, and Economic Securities Act, CARES, Special Revenue Fund to be authorized for use to cover pandemic response costs incurred in the county operations budget from no earlier than March 1st, 2020 through August 31st, 2020. 6.11, approve estimate of just compensation by market value appraisals for right-of-way for the reconstruction of County Highway 83 in the city of Shakopee. 6.12, approve estimate of just compensation by market value appraisals for right-of-way for a roundabout at County Highway 2 and County Highway 15 in Helena Township. 6.13, approve estimate of just compensation by market value appraisals for right-of-way for a pedestrian bridge and trail along County Highway 17 at Trunk Highway 169 in the city of Shakopee. 6.14, approve record of disbursements and approve claims. 6.15, adopt resolution number 2020-145, supporting the proposed incorporation of Credit River Township as a city. 6.16, approve the request for a home extended business interim use permit to operate Advanced Exhaust Solutions. Marco Popovich applicant and Marco and Kelly Popovich property owners in section 12 of Cedar Lake Township. 6.17, approve payroll processing of personnel actions. Those are the 16 items on consent.
Mr. Chair, I'll move approval of those items, then maybe we'll have discussion.
We have a motion and a second, and we have some discussion. Looking to my left, Leslie.
Mr. Chairman, I just wanted to add that after we had submitted the packet for Credit River, we did receive Spring Lake Township's resolution of support. So they also did provide a resolution of support. It just arrived after it had been
Perfect.
posted.
No, that's good to know. And the cities that we talked about in the workshop, so that was all good.
And Mr. Chair, in the discussion, I'd just like to put it on the record, our approve of payroll processing and personnel actions looks very different than usual. There's a bunch of new temporary employees on there, and just want to tell the public it's for the elections, and all that we're doing to make the elections high integrity, good ballots counted, safe. And I assume that some of those costs are coming out of our CARES funds.
We're hoping so, but thanks for pointing that out.
There's one other thing on there that I just want to call your attention to. Jim Henches, the county surveyor, after 40 years of service to Scott County, is retiring. Just knowing Jim, he wasn't interested in coming to the board, but if you folks get a chance, it has been a significant investment that he has given to this county. He is another one. I remember my first day here in 2002, he was the second person I met with, and he didn't do highways. Well, within 6 months, they were providing the highway right-of-way maps. He was breaking down silos. He was instrumental in moving some of our life of a parcel, which made land records, planning and zoning, taxation, the survey department work better together and break down triple reviews of plats. He is going to be missed by this county and has really been a dedicated public servant for a long time.
Yeah.
And can I add to?
Yes.
We used to call him Luggo. I don't know if he likes that anymore, but I worked with him actually my first real job in 1976 at Minnesota Harvest.
Oh, yeah.
Yep. We dug out little holes for irrigation, and he worked through the fall. Always real nice, good worker. So gonna miss him. So
It's a loss to the county, no doubt. But we have a couple really good registered surveyors also coming up. So the other thing, to Commissioner Brecky's point, this is going to allow us now, as soon as these absentees go out, to provide a county staff with a lockbox at each one of the city halls or the libraries, depending upon which city they are in. It also is going to provide us enough staff to make sure we get the requests for absentee ballots out to people on time and processed and then monitored. So this really is a huge effort that our staff are undertaking to make sure that we do this securely and that we do it timely and that everybody's vote does count.
Yep, both very good points. So thanks for bringing those up. All right, so we've got a motion and a second on the 16 items on consent. Looking to Deb for roll call.
Commissioner Weckman Brecky.
Aye.
Commissioner Wolf.
Aye.
Commissioner Beard.
Aye.
Commissioner Beer.
Aye.
Commissioner Ulrich.
Aye.
All right, thank you very much. Now we're gonna move to 6.9, the item that we changed up front, and that's gonna be a presentation. And you're the center of attention today, aren't you?
Good morning, I'm back. All right, so thanks for having me here today, talk a little bit about this grant opportunity focused on implementing a community-based navigation model for families with young children. Just to give a little bit of background about the grant, it is really targeted towards two populations. One, pregnant and parenting families with young children, 0 to 8, or pregnant and parenting families experiencing homelessness. The intent of the grant is really around making it easier for families to get services or supports that they need. It's to increase the access to services, and that is coupled with the piloting of two web-based technologies. One being Help Me Connect, which is a web-based technology specifically to help parents with young children learn about, access community-based services. And the other one is the Bridge to Benefits, which again is another web-based tool to help look at what financial resources may exist to families in their communities. And third, and perhaps really the most important, it is really around community engagement. It is to help grow and solicit input from the community and drive community-driven solutions. Some of the grant requirements, there is a project coordinator, a full-time FTE connected to the grant. That position would be solely contingent on the acceptance of funding and continuation of any funding. Again, we'd have to agree to pilot this web-based technology, participate in program evaluation and statewide communities of practice. From a budget standpoint, it would be $300,000 a year, up to $600,000 for 2 years. We are still working on details. Grant is not due for, we've got a whole nother week to work on it. But some of the expenses would be the FTE, training and consultation time from the mental health center, concrete supports for families, technology, translation, program evaluation. So those would be some of the high-level budget areas. So what is really our intent or thinking about the plan? From a focus standpoint, we're really looking to leverage, and we talk much about this in Scott County Delivers, the existing resources and partnerships that we have in place. How do we organize? How do we develop a coalition to be embedding services and supports to families in their community? Again, how do we do targeted outreach? How are we helping to provide that community access and build a strong network of providers? So how are we going to do that? Well, our proposal is that we would look at 3 community-based sites to act as what we would refer to as hubs, community hubs. We are still in conversations, but we would hope that the River Valley YMCA is a site partner for that. Shakopee Library, although I will call out that all Scott County libraries have expressed interest in piloting the web-based technology. And what they really talk about is every day they are talking with residents who say, how do I get this need met for my family? How do I access this service? So the idea of embedding the technology across all libraries, again, is to help build increased supports for families. And the third site would be the Jordan Area Food Shelf. In the grid below is really the identification of partners who have expressed commitment to help support or serve in this grant, if given the opportunity. Again, you have Mental Health Center, Insaroon, which is a cultural navigation nonprofit out of Dakota and Hennepin, and they work alongside Somali or East African families. We have Beacon. Beacon, we hope, would be part of a sustainability plan, looking to develop or integrate a community hub within their Shakopee site. So talk a little bit about community hubs or family resource centers. They are really community-based, family-focused centers that bring in services, supports, programmings to parents, to families where they live. So they're designed to serve a diverse population of families and to help grow community and to really strengthen families. We talked a lot about how do we emphasize the importance of families, and this is really about how do we grow connections and community-driven supports. So as we look at, there is evidence around family resource centers being an intervention that can decrease child abuse and neglect, that can increase family self-sufficiency, and increase parents' own sense of competency or confidence in safely parenting their children. So again, we wouldn't be implementing the whole sort of concept of family resource centers, but as we talk about the development of community hubs, it would be taking this model and implementing it in existing resources. So as we did a lot of thinking with some of the Together We Can and internally, like, why this grant? Why now? And as we really examined the county strategic plan, we really felt like it overlays and parallels many of the key objectives and strategies. So as we look at the key objectives, community safety and well-being, certainly we see this hubs model looking at how do we form partnerships so that residents have convenient and reliable access to services. Housing, again, this is focused on young families experiencing homelessness. At the core, this is around children and families having access to supports and thriving. We're looking at infrastructure. How do we really promote the idea of public-private partnerships? And from a performance standpoint, it is really focused on innovation. How do we look at doing something new, transformative in service delivery that can lead to better outcomes? So when we move then from objectives into strategies, again, at the core, this is really around helping children and families thrive. But if you look at the tactics really under the strategy, each of the tactics is really included in the work of this grant. It is prevention-based, designed to reduce ACEs, would be helping foster literacy-rich environments. We would look at collaboration with WIC, Read Mobile, preschool screening, bringing those services really into these community hubs. Most certainly, it's about increasing that presence of nonprofit supports and increasing the number of adults available to sort of support young people. Then when we look at strategy under performance, strategy number 2, again, broaden community participation across all aspects of planning. Community hubs or family resource centers are really a community engagement strategy designed to serve diverse populations and to give employees, whether it's Scott County employees or nonprofit providers, an opportunity to really hear from the community about what the needs are and how do we build infrastructure to support those needs. And then I also want to just bring us back to the previous strategic plan that had the goal around ending child abuse and neglect. And that work really originated from 2 community conversations that identified potential gaps or needs in our community. And that's really around these 4 identified themes: cultural competence, affordability, service array, and service integration. And we so see that this grant aligns and parallels with the opportunity that this grant has to meet these needs. So to summarize some of the opportunity, the grant provides the opportunity to live out some of the values, goals, objectives in the county strategic plan. It moves interventions upstream. Currently, child welfare, as designed legally, is a reactive system. We want to say, how do we become more preventative? Because we know it's better for families and it's less costly. Community hubs are a family-driven support, the idea of a one-stop shop. For my tenure here, we consistently hear families talk about the idea of, like, I need this, but you have to go there. Oh, but I need this too, so now you have to go over here. This really talks about how do we align those services in one place, and again, lives out the objectives of bringing faith communities, faith providers, nonprofits, and Scott County together to serve families in a different and better way. So in summary, again, we see the grant really aligning with the strategic plan. It takes action. It moves us away from, I think, the ongoing conversations about planning and puts it into implementation. Reduces child abuse and neglect. Provides ongoing funding for the next 2 years to build this. It crosses geographic areas so it can serve both the bigger communities as well as rural communities. And it leverages funding and coordinates across public and private partnerships. Questions? Excuse me, Chair.
Yes, by all means.
Suzanne, what's our timing? When is it due and when will you be notified if you receive the grant?
So it's due the 21st of September. We would be notified end of October.
Okay, and then is the term 2021 to 2022 then?
Correct.
Okay, thank you.
Yep.
Mr. Chairman, this is Commissioner Beard.
Go for it.
Thank you. Just a couple of questions about the presentation. First of all, we're looking at $600,000 over the next 2 years. I'm assuming the grant assurance, or getting the grant is probably a pretty sure deal, or we wouldn't be applying for it. But this $600,000, is any of this actually going to constituents, or is it going to pay for the streamlining of the ability to access programs and so on and so forth?
We would see a large amount.
Staff person for 2 years, I'm assuming that's about $120,000 or $130,000 a year of the money. What's the rest going to pay for?
So we'd see a large percentage of the funding really being around concrete supports to families, both from transportation, what are the barriers to get them to supports or services? Is it diapers? Is it childcare? And potentially really creating some incentives around meals. How do we share a meal? Again, assuming the pandemic puts us in a different place. But how do we offer opportunities and incentivize the opportunities for families to access these services with the idea that really once we get this up and running from a sustainability, we would see this as pretty minimal, that we would have the partnerships in place, we'd have a schedule in place, and that infrastructure of partnerships is well established.
Okay, so I'm seeing I heard a couple of practical things there, like maybe transit services or transportation services to help move people around that need it to get to an appointment or a screening or something like that. So a related question is, a lot of these things already county welfare system. Can we not coordinate this, or haven't these been coordinated already? Is this a new idea? Why hasn't it been done, or why would it take a federal grant to do something that seems to be pretty common sense already? And I'll tell you where I'm going with the concern is, it sounds to me like we're creating another layer rather than breaking down some layers or shortening the journey between an applicant walking in the door saying, I need help, and finding all the help. It sounds like we're adding another layer on top to coordinate help that probably should be coordinated already.
Yeah, I think, Commissioner, thanks for the question. I think the idea is that as we look at embedding services in communities, to make it less like I have to go to Shakopee to apply for services or whatever those, that we bring the services into the community so that they are more accessible and they've in fact become more normalized, and they are provided perhaps by some Scott County staff, but also by a network of nonprofit faith organizations that come in to do that alongside and support families.
Okay, so I guess that the end game is when this grant expires, and I'm assuming we're going to get it, when this grant expires at the end of 2022 and the position goes away, the new efficiencies and the new infrastructure is going to be in place and will continue to sustain itself without having to add it to the levy.
Correct.
Is that a reasonable assumption on the board's part?
We had it correct, but it might have been a little bit of a.
Correct.
I don't want to answer for you, but I think it might have been a little bit of a
Yes,
crossover.
that would be
digitally.
correct, Commissioner, that we'd really look at, again, using this essentially startup dollars to create the infrastructure and the schedule and the partnerships so that at the end of 2 years, this would really be not county supported, but really supported through the network of partnerships.
Okay, good. That helps me. That helps me be a little more comfortable with asking for some more federal dollars here. If it can do something that puts a program or a situation in play, a process into play, so when it expires, things move more efficiently and more effectively than they do now, and we won't have to raise taxes to keep it efficient and keep it working well. I can be okay with supporting it then. Thank you for indulging my questions and my concerns. Appreciate it.
Thank you. Other questions?
I'd just point out, I think it's state, it doesn't make a difference, they're all tax dollars, but it is Minnesota state tax grant. And Suzanne, could you comment on Commissioner Beard's thought that I mean, how many people are applying? What is our likelihood of getting this grant?
I don't know, like there's only a handful of sites that will be chosen. I think the collaboration and partnerships that currently exist and the support for the program certainly positions us well, but I wouldn't necessarily be as confident perhaps as thinking it's a for sure thing.
Okay, thank you.
But now she did say she's got like a full week to work on it.
We
so
got
it's
one
just
more
gonna
week to go, so we got a lot of
we
time.
got all
With
kinds of.
nothing else to do.
Yeah,
Right.
exactly. I mean, like, she's a week. I'm like, oh, that sounds tight. Like, we can.
We got a lot of time.
Jazz it up. All right. Is there any other questions on this while we have her at the podium? All right. Well, we are being asked to.
Mr. Chair, I will move to adopt resolution number 2020-150.
Second.
We have a motion. We have a second. Is there any further discussion? Looking to the screen and my left and right. Otherwise, Deb is ready to go.
Commissioner Weckman Brecky.
Aye.
Commissioner Wolf.
Aye.
Commissioner Beard.
Aye.
Commissioner Beer.
Aye.
Commissioner Ulrich.
Aye.
We will be excited to see those new efficiencies rock and roll in 2 years. Awesome. Thank you so much. All right, now we're going to move to 7.1, looking to adopt resolution number 2020-142, authorizing entering into a service agreement with Guild Incorporated to provide intensive residential treatment and crisis bed stabilization services.
Good morning,
It is
Mr.
still
Chair,
morning, right? It is still
Commissioners.
morning. Yes,
Thank
good
you for
morning.
this opportunity. I am really happy to be here today. Some of you may know this project has been in the works and on our platform for many, many years. So feeling like this is a good opportunity to bring this forward and kind of, I don't know if this is the final time you'll hear this, but hopefully we're close. Oh, Deb. Okay, Deb, how do I move? Sorry. Page down, okay. I might have a hard time with between mask and glasses, so excuse me. Anyways, gonna go back in history just a little bit and kind of refresh your memory. Many of you were around. This project actually goes back till 2014. One of the board's strategies back in 2014 was that mental illness is not criminalized through community early intervention and support. We brought together a broad range of stakeholders that came together to admire this issue. And it took us quite a while to do that. Some of those stakeholders included our Sheriff's Office, the Savage PD, Community Corrections, our local Mental Health Advisory Council, the jail, County Attorney's Office was at the table, Public Health. We had one of our judges, community providers, and of course, social services. So a couple of the primary objectives as we looked at this issue was to use data to drive our decision. And one of our goals or objectives was really to look at what are some of our gaps and strengths and gaps in our system. All right, so as we looked at this board strategy work, here are some of the data-related pieces around utilization, access, and the cost to the county around this. And as we evaluated our continuum of services, we looked at some of our strengths and our gaps, this was one area that really rose to the top. It was, people were having to call, we were seeing a very significant increase in need. People were traveling long distances. We had challenges. I think some of you may recall in 2016, we took a pretty big hit to the levy due to some challenges getting folks out of the Anoka Metro Regional Treatment Center because we had no place for them to go. So this idea of one of our priority needs was local mental health crisis beds and IRTS, or intensive residential treatment services, really rose to that top. That's the wrong way. Sorry. All right, so just very briefly in terms of what crisis stabilization and IRTS are. These are both residential programs that are provided in the community and have 24-hour mental health support and staff available for support. Crisis stabilizations are generally very short term, up to 10 days. IRTS, or intensive residential treatment services, up to 90 days. Really kind of looking at these services offer an opportunity on both what we call step up and step down. So it's care and support for those living in the community to keep them out of, that might be going through a mental health crisis, to keep them out of the hospital. It's also a possibility for treatment for those transitioning out of hospital level care or places like the Anoka Metro Regional Treatment Center. So we identified the need, strong need, had the board support, but now what? What do we do with this? So this is what's taken us a while. In 2016, an opportunity came up for what was called a planning grant. So we received about $80,000 from the DHS at that point, to really look at kind of what do we do from here. Really looked at engaging our community around this need. It was involved a number of stakeholders across the system in terms to verify, do we in fact have this need? What do people see? What do we want the design, the possibility to look like moving forward? It was really the spot that we engaged many of our partners. But the reality is this project really didn't come or take off much until 2018, when we received a direct bonding allocation of $1.9 million from the state legislature. And then we actually also applied shortly thereafter for a grant and received roughly about another $2.26 million, or a total of $4.16 million. We also received great support from the city of Savage, who donated the land. We received donations from Scott County, Alliant Health. We've also had excellent partners at the table with Guild, the CDA, and Scott County. Just to back up 1 second, back in 2016, we reached out, we had a short time frame on that planning grant. We reached out to all of our local mental health providers, who's gonna work with us, who's willing to kind of pursue this with us, and Guild was the only provider at the time that was saying, yes, we'll apply for this, we'll work with you on this, we will see where this goes. So they have been with us around this planning for the last 4 years. We had, many of you may recall, almost to the day, we had our groundbreaking ceremony a year ago on September 16th last year. So the planning has become a reality here. We have a Savage location that allows our residents to receive this service locally. It is a 16-bed facility. I think you all are going to have an opportunity to see it on September 29th. We have the ribbon cutting ceremony. This particular, you've seen many agreements before. Danny's brought many for around other aspects of the project as we've moved along. But this is really the service agreement, which is going to allow Guild to open their doors and actually provide these services in the community. Just a couple of things specific to the grant, or to this particular agreement. Guild will screen and assess and determine someone's eligibility for admission. Both crisis residential and IRT services are billable services under medical assistance, the local public medical assistance programs, some private medical providers. Guild is our service provider for this. Scott County residents will have a priority for beds, and the agreement does include holding one bed for Scott County residents. We have the ribbon cutting scheduled for, I think I mentioned, September 29th, and Guild is actually hoping to open their doors on or about October 1st. There are a number of folks I just think I need to recognize around this project, because as you hear, it's been a 6-year project for us around making this all come together. Really kind of starting from our original board strategy work group to our local mental health advisory council, who's been a strong advocate and supporter of this project from the beginning. Our other excellent partners at the table, the state of Minnesota, Dakota County, the city of Savage, Alina, the CDA, and Guild have all been excellent partners helping to move this forward. Oh, excuse me, I just got to do this. Internally, we have a number of staff that were key to this project's success. Jennifer Schultz and Danny Lenz have made great contributions with all of their work in procurement and help navigating the finances and the endless agreements you've seen before. And I also need to just acknowledge Danielle Fox played a huge role in obtaining the over $2 million. She was our primary grant applicator or whatever. And it has really been my right hand through this entire project. So, and of course, finally, I need to thank all of you because this project would not have happened without your support and your backing all along this project. So again, a great partnership here. There were many a times, Gary Shelton will say, that I said this is never going to happen. So I am very pleased to be here today to say it is finally happening. And I guess asking that you adopt Resolution 2020-142, authorizing entering into a service agreement with Guild Incorporated to provide intensive residential treatment and crisis bed stabilization services. And I would be happy to entertain any questions.
Well, we do have the resolution before us, but I'm kind of feeling like this makes it more official, doesn't it? Is that what kind of makes it?
Oh, do you have it?
Shh, put that down.
Yeah, can I just ask, Mr. Chair, what does it cost per day to treat one person? It's a lot.
It's a lot. It's several hundred. It's a lot less than Anoka. Anoka Metro Regional Treatment Center is, if you recall, is over $1,300 a day.
Yeah.
I honestly, I have not heard officially. DHS actually works with private providers to set their rates. My guess is it's, and I hate to say too much, my guess is it's probably in the range of $300 or so a day. But perhaps you haven't heard, do we?
I think that's about what we've been estimating.
Because I remember,
Yeah.
we were first to learn, because it was almost like $500,000 if they stayed a year.
Yes.
More per, it's like, oh boy.
Yes. And we actually have a person there right now we're trying to get out. So we're anxiously awaiting the opening. So instead of paying $1,300 a day, hopefully their insurance will only pay $300. So.
Great.
That's a big point. That's a big point with this, is that
Right.
it was
This
the,
leaves-
no, I'm just saying, I think that's worth pointing out. That's,
And this
helps people
always
save
leaves
money.
a bed for a Scott County resident when available, and it's kind of unique, right? I mean, it's been built for this versus converting some old building or something.
Leslie, you're absolutely right. I can't wait to see it. I've seen pictures as it goes along. I'll certainly be there the 29th. But really, and I kind of touched on, that original planning guide really tried to get consumer feedback, family member feedback. This facility, so many of these facilities across the state are retrofitted other buildings for this purpose. So this building, I think, really enlisted, it's 16 private bedrooms with the bathrooms. It is intended, it's going to have adequate therapy space for folks, and it has really been built for this intended purpose. So yeah, it is really pretty exciting to see it come together. You asked another question beforehand.
There would be a bed held for
Yes,
Scott County, right?
yes,
That was
yes, yeah. People need to understand, state has invested a lot of money in this. It's a statewide facility. These are services paid for by state dollars. But generally, the preference criteria always on these type of programs is to serve people locally if you can. So just as we have been sending people to Mankato and to Duluth and all parts of the state for these kind of services, the preference is really, though, to serve folks locally. They can be in their own community. So the priority will certainly be Scott County and Dakota County residents. But as well, we did built in, given our significant kind of contribution support to this, that they will always try to say one bed. We fill it up with someone, then we might have to wait for someone to leave again. But yes, that is built into the contract.
so I just, one question on that, so it's not a guarantee, it's a, well, it's not even really that. Because if you've got 16 was the max, because otherwise it kicks into some new licensing thing or whatever, right? See?
Hey, see? And they say you don't pay attention. Oops, sorry.
Wait a minute.
Yeah, I don't say
Wait a minute, did I say that?
Sorry, yes, Commissioner Beer, you are Mr. Chair, sorry.
So the, like, how do we think, because it's probably gonna fill up, right? I mean, there's not like no need, there's need. And so 16 beds are full, and all of a sudden, hey, Scott County needs a bed. Well, in 89 days, we got one for you. Like what, that's always been one of my questions is it guaranteed?
Well, we aren't going to be, Mr. Chair, yes, I mean, we aren't going to be able to guarantee. So what we have built in, and we actually, this was a bit, we had these conversations just recently with Guild when we were working through kind of finalizing the service agreement. They will hold a bed for us, but if in fact we have someone go, we have the Canvas, the crisis team is out and sees someone and they need that, so now they're full. So it's not like we can kick someone out then.
Yeah.
So we'll have to wait until someone leaves. Crisis beds turn over fairly quickly. Obviously, with the IRTs, the longer term, they're there a little bit longer, so they're difficult to predict. So I can't guarantee the next night the crisis team needs a bed that there's going to be one there. But when one opens again, Guild is part of the agreement is they will hold that until another Scott County person comes in.
So there could be an empty bed, it would open up, and if there's only a waiting list of people from other counties, they're supposed to keep that bed open for a Scott County resident. That's my understanding, right? And is there, I'm sure it'll be based on need, but is there a limit? Like, are there always gonna be some beds open for crisis? Or could it be that they're all IRTs? If it went that way.
You know, we've left that fairly fluid. I think it is not our intent that it be that it is strictly for IRTs, but I think we also. So no, I think we also want some fluidity, that if we aren't seeing a lot of need for crisis stabilization, that they may increase. We don't want it being underutilized too, so we're trying to allow some fluidity with that.
Great.
All right.
Any other questions?
Mr. Chair?
Yes.
I'll make the motion to approve, resolution 2020-142.
And Mr. Chair, I'd like to second John's motion.
We have a motion and a second on the floor. Is there any other discussion? Seeing none, Deb is ready to go. And so is this facility.
Commissioner Wickman-Brecky.
Aye.
Commissioner Wolf.
Aye.
Commissioner Beard.
Aye.
Commissioner Beer.
Aye.
Commissioner Ulrich.
Aye.
Nice. Looking forward to the 29th. Is that what we're? Bring your mask, people. All right, let's move on to item number 8.1, adopting resolution number 2020-138, approving the 2021 budget in the amount of $14,161,686 and payable tax levy in the amount of $3,700,036 of the Scott County Community Development Agency and certifying same to the county auditor. Now I feel like when the crew from the CDA comes in, it's almost like an entourage. Like we need some smoke and some lighting. I'm not sure.
Walk-up music?
See, walk up. Yes, thank you. Some walk up music. Some walk up music. And nothing. We got silence. Sorry.
How do we go about doing that?
Well, maybe next year we'll have that lined up.
Your supply.
Right.
Here I am.
So thanks for being patient in our little hallway out there.
Thank you.
It's all yours.
Fantastic. Well, thank you for having us today. I get to kick things off. I think I can pull this down.
Do it.
Okay. That way everybody can hear me a lot better, and then I'll put it on and I'll go that way.
I didn't know it was you.
Yeah, I know. Surprise. It's Stacy Crakes from the CDA. So I get to kick things off today, and then Julie is going to talk a bit, and then Bill is going to wrap everything up. So thanks again for having us today. We're excited to share some of our updates. So first we wanted to just start with a reminder of our updated mission, vision, and values, because we've really been using those. We brought those to the board last year. We've really been using those different areas to guide us in the different decisions that we've been making, particularly over this past year. You know, we constantly are saying how we invest in possibilities to live and work in Scott County. It really incorporates the housing piece and the economic development piece. We've been trying to incorporate our values in everything that we are trying to move forward with. And then as well, our vision to pursue opportunities for economic growth, develop pathways for residents to have affordable homes, and cooperate with communities to design achievable goals that support all people's lives is really the basis that we're going to try and use for this presentation today. So starting off with pursuing opportunities and celebrating achievements with an eye to the future. First up, the IRTs. So fancy timing that was just on your agenda. As you look across the work from the CDA, we're continuously pursuing different housing, economic development, and partnership opportunities that are forward-looking and contributing towards the successful growth of the county and helping in meeting goals. So later this month, we will be celebrating the grand opening of the IRTS facility, as I'm sure you're all very familiar with. And this has been a multi-year partnership that will benefit those in need of mental health crisis services, the families of those needing care, as well as the various departments who assist in providing this care by having that facility right here in Savage. Throughout the presentation, you're going to hear how the CDA has been working to continue increasing the supply of housing throughout the county. And for the first time in almost 8 years since I've been here, we actually implemented a small business program where we targeted grants for small businesses. So we'll talk a little bit more about that. As we continue to look ahead, we're in the process of starting to talk about updating our comprehensive housing plans and commercial industrial studies. We do that generally every 5 years, and we're coming up on the 5th year to start doing that. And then, this is kind of stating the obvious, but the COVID-19 response and recovery and the uncertainties around that, obviously that's an ongoing area that we will continue to be looking at as well. So the next part of our vision that we'll be talking about is this economic growth, which really encompasses much of the economic development work that we do. And I wanted to just start off with a quick update on some of the COVID-specific programs that we've been working on over this past year. So as I mentioned before, the CDA rolled out this small business relief grant program. We had started talking about that early on in the whole process of COVID and when the pandemic hit. We managed to pull together $100,000 of CDA money, so it was not CARES or federal money, that we put out to different businesses. And you can see on the pie chart, there was a pretty nice spread of where that money went throughout the communities. And that, all 20 of the grants that we funded have been dispersed at this time. So with that, we worked with a company called Next Stage, which is a nonprofit partner to administer that program. And that's the same nonprofit partner that we're working with on the CARES program as well. And maybe with that, I'll roll into the CARES program and just give some updates so that you guys can see kind of where we're at with all of that. So we've been very busy trying to get those applications open and collecting information from various businesses throughout the county. Again, we are working with Next Stage, so we are not seeing any of the application information. It's all going through our nonprofit partner. There was $5.2 million approximately allocated directly to the businesses themselves for these different applications and grants. And what we did is we had about a week and a half of application time open. We ended up closing it on schedule. We were still short of what money had been allocated, and we had a few businesses reach out and say, we just heard about it, we just missed the deadline, is there anything that we can do? So we did go ahead and reopen the link for another week so that different businesses had a chance to come onto a waiting list. And the thought was, let's give people a continued chance. We understand that there was kind of a short turnaround on this. We're trying to reach businesses the best that we can, but we don't necessarily, well, we know that we're not reaching everybody who's out there. So once we closed that, here's kind of the numbers that shook out. So we had 60 different farmers and agricultural businesses that had applied. We had 171 in-home child care businesses who applied. And then we had 210 small businesses that applied. So where we're at right now, Next Stage has been reaching out to all of those businesses. asking for the verification and documentation that they need to confirm eligibility for the program. We are finding that confirming other sources of funding is difficult. So I think what we wanted to make sure that we are stressing with you, because I know that double dipping has been a huge topic of conversation, is kind of some of the steps that Next Stage is taking to do everything that we can to try and make sure that that's not happening. So we are requesting any previous funding that somebody has been awarded through any program, essentially this entire year, they're supposed to disclose that to us. Some of those are still under review, some of them haven't necessarily been awarded yet. So having an actual number versus what they've maybe applied for is something that Next Stage is going to continue to try and work through. We are also requiring that they sign a self-certification statement that will be provided for every grant that goes out, essentially saying what I am giving you as a business owner is true to my best knowledge, which hopefully gives us some more confidence that we're trying to cover the fact that even though they might have applied for something and they don't find out until after we award this money, that ultimately the responsibility still does come back on them when it's their turn to go and do their taxes. We have gotten that question a number of times, and ultimately our answer is we trust that you'll have to talk with your tax representative to identify how this is all going to pan out at the end. But we are diligently documenting and tracking and keeping those records so that we have those moving forward, and hopefully we'll avoid any issues when the auditing time eventually comes around.
Quick question, if I
Yes.
may. The first 100 grand were like 5K, boom.
They were.
Like, how is this?
This is different. So the CARES money is allocated differently. So the farmers and agricultural businesses can qualify up to $25,000. The childcare businesses can qualify for up to $4,500. And then the small businesses, there's kind of tiers within there. So we have a sole proprietor tier with no employees who can qualify for up to $7,500. And then everybody else can qualify for up to $15,000. So when we did the analysis of all of these applications that came in and an estimate of what we expect they could max out at if they can prove eligibility on everything and nobody drops off, we would be about $300,000 shy of what was allocated by the county to do these grants.
And so then, this might be more internal, because we need to get that burnt up by such and such a date, so that might come back or get thrown into one of the other categories.
So what we're waiting to see is how this allocates out. In my discussions with some of the other counties, they have also gone back out for small business again, and they've opened it back up to see if they capture any other businesses. But we're waiting for them to do their analysis and see what the final numbers are before we make that decision. Remember, housing is just going to open up this week, I believe, as
Right.
we're finalizing that. So we'll have to see how those come in. The schools have moved forward, technology has moved forward, and they're currently, right now, working through, I know Jen and Chris and Lisa are, the contracts with some of the nonprofits and the food shelves. So once we get through this first round, then we'll be able to come back. Chris's goal, I believe, was to give you a summary of everything at either the work session on the 29th or the first board meeting here coming up in October.
Bizarre days, having trouble getting rid of money.
Well, it's not just the county.
Yeah, no, right,
Yes.
yeah. I mean, everyone's got this CARES money and want to get it out to the community. So another question I had is, the 5.2 was from the county that came from the CARES. Are you guys administering any money, anybody else's money for different cities or in the county, or?
Well, not directly.
Okay.
So we are helping to coordinate though. So
Got it.
one of the things that I wanted to mention as we talk about cities and even townships now wanting to maybe put some of their money out to businesses is that we're talking about opening up our link to apply again. Because part of the cost in launching a program is developing that link. And so we can make a few modifications, say You know, the city of Savage is looking at opening up something again. I'm not sure, I think Prior Lake is looking at potentially either piggybacking on the applications we already got or opening up something potentially again. We have Newmarket Township that reached out. So if we can open up this link, each community can theoretically still have their own program, and they could directly work with Next Stage to administer that in the same way that they're administering the county money right now.
So I'm just thinking, you know, we want to try to get this, the double dipping was a big deal if they already got something or whatever. Trying to get this to spread as far and as fast as we can. Is it, probably the answer is yes, but is it possible that if it's Shakopee's doing their own or whatever, I think, I don't know, let's just say they are, you guys are administering yours, can the same company potentially, because the timing is such that, hey, I can go to Shakopee and get some scratch, I can go to the CDA and get some money?
Theoretically, the timing is like that.
Yeah.
And the way that we are approaching it is that we have reached out to Shakopee. They have provided their list to us. We have provided our list to them. So we are trying to do that due diligence to avoid that from happening. Yeah. Ultimately, as long as a business has enough expenses to justify that they are eligible for that amount of money, then that's not an issue. It's once what we're seeing a little bit with the daycares, for example, is that there's been a few different rounds of funding that have come out. There's been some that have shifted to seeing more kids come, while others maybe had to shut down for a while. And those daycares that had more kids come with a higher, more pay, don't necessarily have the expenses that we can tap into to say, here's another $4,500 that we can justify. So it's really been this balancing act.
I get it. It's like super bizarre. I just, you know, I get that they might have the expenses that warrant it, but you know, if there's some company that, hey, we just found out and we didn't get anything, it's like, well, spread the wealth a little bit to.
Originally, we did intend, so the CDA's program was launched with the intent that any other local money, you would not be able to apply for our grants. That was early on in the process, before all of this other money started coming out. So now we have no say and really no control over whether or not they're applying for these different programs. We've had we've had at least one, maybe two, a couple cities reach out and say, well, wait a minute, we don't want you to not fund our businesses just because we have our own program. You know, we want them to have a chance at all of it. So the best answer that we've come up with is when we're reaching out to these businesses, we say submit all possible expenses that you can so that we can try and justify as much money as you possibly can to get, so that if you do get $15,000 from the county and you've gotten the $5,000 from the CDA and you've gotten, you know, $15,000 from Shakopee, that we're still in the clear on what you were able to receive. So, and I will say too, there is a group, a small group within the county CARES applications. We just rolled the CDA applications in, so we didn't force people to apply again, with the thought that we had them already submit $15,000 worth of eligible expenses, automatically approve them for another 10 on top of the 5 that the CDA gave. So in that regards, they're not getting another 15 from the county's program, they're getting 10.
Yeah, yeah.
And Commissioner, you know, Belle Plaine is another one who, instead of keeping a lot of the money, was pushing it out into the community. So they've done their own rental, they've done their own housing. They also had some small business. But in their case, it was a much smaller amount of money and it didn't cover all of those costs. So they very well might have applied under the counties. The same thing with housing. I think theirs was 2 months. It wasn't for 4 months. So it might be that somebody from Belle Plaine applied for August and September through Belle Plaine, and they might apply through the CDA for rental assistance for October and November or something like that. And so I think as long as you know, I'm hearing Stacy, and we thought it was a good solution, as long as the expenses are there and they're eligible for it, to say, no, you can't, was not the appropriate response, so.
Yeah, it's, the timing is, but part of it is not sitting and trying to figure this all out and, you know, get the money out. So I get that that's very delicate and needs to be done with haste. So, thank you.
But it has been interesting to see too how many businesses apply, and then when they're asked for the documentation, they realize that they weren't technically eligible, so they just withdraw and they don't proceed. So, you know, I mentioned that we're probably within about $300,000 of what that total is. That's if everybody were to be eligible for the full amount. So we're going to end up at somewhere less than that. There will certainly be opportunities to do something different with that additional money, which is the whole reason we pushed it out in August rather than trying to wait until September or October when we wouldn't have a chance to look at other options.
Mr. Chair, Stacy, like, are we able to keep a list of those businesses who've just experienced such substantial loss that we're not making it much of a dent? Because I think, you know, if we're back in a month looking at a pot of money that's left, if there's businesses that have had that substantial loss, yet they're still a going concern, they might be able to make it, because we know some just have to close down, you know. What are your thoughts there? Is there a group of those types of businesses out there?
I think that we would be able to track that. The question then becomes too, what might they be qualifying for, maybe
Right.
through other means after we get the information that we get, and we don't necessarily know that. You know, the agricultural piece is definitely a learning moment for all of us involved, and we're still trying to figure out how exactly we process those in the best way to make sure that we're doing the correct due diligence on what the needs were and what the gaps are that haven't been filled. So that's kind of the last piece that we're working through right now. And if you've happened to hear from any farmers, there's been a little bit of delay just because we weren't sure exactly what to be asking for and didn't want to keep coming back asking multiple times for different things. But they should, it was either end of last week or early this week, they were going to be getting an email saying, here are the things we would like to see from you. And we're working with a couple other partners to try and do those different analysis of the information that they provide.
Is the Farm Service Agency, since so much of the money comes through them to farmers, able to share data or cooperate in any way with you on this?
We've reached out to the University of Minnesota Extension Office, and they've connected us with some people, and I think basically what they've suggested is that we approach it the same way that the state has. And there's a food assistance program that went out to farmers, which seems to be the primary source of the funding that a lot of farmers potentially received. So I believe that information's all public. It's definitely information that we're asking for from the farmers. And I think at this point in time, they have all been notified or received what they were set to receive. So hopefully we're not going to be duplicating.
Oh, it's amazing to be able to do all this as quickly as you are, so thank you.
Yep, no doubt.
Thank you. So I'll keep the next, I have 2 more slides and then I'll turn it over to Julie and I'll keep them pretty short. I just wanted to do a quick overview of some of our existing programs. We've had a couple updates this year. One is that we've transitioned from the Open to Business program to this Next Stage for Entrepreneurs program. Ultimately, we really wanted to try and get something that was more locally focused. And so we've been working with Lee Hall. He's our business advisor. He's also the person who's been managing all of these different loan programs. We've heard nothing but tremendous things about working with him from all of our communities. So once we get through these different funding opportunities, I think we'll be able to dive more into the business assistance. But he has been helping a few of our businesses who just want some general consulting. So that program will continue. The Fast Track Challenge is happening again this year. It's our 4th annual Fast Track Challenge, which is like our Shark Tank competition for new businesses. So that's being held October 22nd. We have a fantastic panel of judges. And it sounds like it will most likely go virtual, but that decision hasn't been completely made yet. I think that will be announced later this week. With the CEO Next program, which is actually a county program, that is targeted at second stage businesses. we are responsible for helping to recruit businesses for that. And so we are hoping, we're not really sure what the current environment is going to do as far as finding businesses who are willing to participate and not donate, but put the time and effort into it. But we're hoping that we can utilize some of the information we've been collecting to identify those businesses that are most likely eligible for that program. And then lastly, we're still continuing to work on this community resource website idea with the hopes that we might be able to launch something potentially even early next year. So looking ahead, we're going to continue all of those programs. We're looking at also introducing a couple new programs. One we're referring to as an Economic Development Assistance Program, which is really our Economic Development Incentive Grants, EDI grants that we've had in the past, turned from grant to loan program. So it's targeted at our communities. Projects like the Elko New Market Utility Extension Project would be part of that program. And it would ultimately be longer term loans with our partners to try and help move economic development projects forward. And then the Business Loan and Relief Fund is intended to be more of an ongoing revolving loan fund for businesses that we'd like to roll out. Obviously with COVID and the need for flexibility over the next year, we're not exactly sure what that'll end up looking like, but it's something that we want to make sure that we're prepared for to help continue the relief and recovery efforts of our businesses. So with that, I'm going to turn it over to Julie, unless you have any questions for me.
I have one question.
Yes.
I think it was it the Scale Zoom where Greater MSP gave a shout out to First Stop Shop?
They did. That was so nice.
It was. And so I had a question.
Yes.
I mean, it's only been, a couple of months or whatever, but, is there a closer relationship with them? Because it seems like, Scott County has kind of been painted with a certain brush already, from commercial brokers at least. Is there a renewed willingness to partner, work with, be a little more, not that they weren't closed off, but just a little easier to work with?
So I can only give you my perspective
Yep.
on the whole Greater MSP picture. As far as I'm concerned, we've worked really well with them the entire time. We worked with them a lot on the Shutterfly project, a lot on the Data Card project, a lot on some of those early projects from when I started. We've been in constant communication. We've been asked to be parts of panels and be included in different groups. And I feel like sometimes there's just a lack of awareness that we are interacting as much as we are. So perhaps that's something I need to do a better job of. But I know other communities have different opinions. And there are sometimes where even we hear about projects that are happening in our own communities that we hadn't heard about until we read it in the newspaper.
Right.
So I think a lot of it is having that dialogue. Greater MSP has kind of transitioned away from how they initially started into more of, they're calling it a partnership network, essentially. So into this partnership where they're there to help. They're not there to take credit for things, and that's kind of how we've been the entire time. So
Right.
I don't know that I directly answered your question, but
Well, I just, you and I have had conversations over the years of just, sometimes once a commercial broker makes an opinion on an area, well, that's gospel truth and they'll never change from big box or whatever distribution. So I was just curious with, just where we're located, their current situation, if there's an enhanced, renewed way of looking at our dirt down here in Scott County. That is just more of a question.
Yeah.
Mr. Chair, if I could comment on that.
Yeah.
I've been attending probably 6 or 8 business investment task force meetings in the last few months, maybe it's a little longer than that. But Scott County gets extremely high marks, probably the highest marks in the region from Greater MSP in terms of the ease of working with Scott County with the First Stop Shop and us generally. They wish we had the same kind of dynamic across the region, and they don't. And they have people slow walking deals and not signing disclosure agreements and being uncooperative. They don't find any of that in Scott County, and they tell me that way
good.
Yes.
It's good. All right, thank you.
All right, thank you. Turn it over to Julie.
Well, good morning, Mr.
Good
Chair and
morning.
Commissioners. It's great to be with you. Oh, geez.
I know
Great
it's
to be.
touchy. It's touchy. That
It
microphone's touchy.
is. It's great to be with you in person. So I'm going to pick up and start talking about affordable homes and the different solutions and services that we have here. So if you remember when we were together, I think it was the end of last year, we had a housing board workshop to kind of give you an overview of housing in Scott County. So this is a little review of that. So we talked about 3 buckets. We talked about physical units, we talked about rental assistance, we talked about services. We talked about how those things land on a continuum. So this is just specific to CDA programs. So on the top we have the project-based programs, and again as a reminder, those are housing assistance that's tied to a particular unit. As long as someone lives in that unit, they receive the benefit that is associated with it. And then down on the bottom is the tenant-based programs. Those are tied to a person. So as long as that person has that assistance, then they receive those services in that way. Just a couple of things to highlight here. So the federal programs that we administer and the state programs that we administer, those are really our deep subsidy units. So we are serving right around 780 households in Scott County in those various programs. Primarily, they are either working or they are receiving Social Security disability benefits. 92% of those households fall in one of those categories. We also are serving about 1,500 kids on those programs. So a significant amount of the work that we do is supported by those federal and state dollars. I have a great team at the CDA of about 13 staff who do a lot of great work with those families. But what I'm going to do is I'm going to take you a little bit deeper into the programs that you see on the right. So these would be programs that are not, they fall in more of the shallow subsidy end. The first one is our 55 plus developments. So you have heard Bill talk quite a bit about Brentwood Terrace and that development that has been occurring over the past couple of years. And it is currently 63% pre-leased. There are 37 units that are reserved, 22 that are still available. It is expected to open in December of this year. Bill talks about how this is 109 units on that campus that will support the pharmacy, the clinic, and the county library there in the city of Jordan. And then I put down for you just a review of all of the 55 plus developments that we have here in Scott County, of which there are just under 480 units once this 9th building comes online. And you can see that we have a very strong waiting list. So there are nearly 350 people who are waiting for those units as well.
Mr. Chair, Julie, could you just remind us, because on the previous page talked about shallow subsidy, that's where this was, and it gave those income limits.
Yep.
If a senior who's over 55 has income over that 55,000 or whatever, can they not live here, or they live here and they pay a different rate?
So these are flat rents. So they, it goes up to the 80% of the income on the right. So they can qualify for this unit. The average income is right around 45,000 or so. So we aren't really getting up to the highest amount, but the bonds allow for 80% of the area median income.
So if a senior, who has more than that wants to live in one of these projects, they can't. Is that true?
I believe that is how the.
We don't income restrict.
Yeah, I didn't think, so I just wanted to be clear on how that fits in, these projects fit in.
Right.
So anybody who's 55 plus can live there?
55 plus, yep.
Okay, thank you.
Can I just ask,
Sorry.
just a side question?
If you could pause on this slide, it went by quite quickly. Say again, Julie, how many people are in this deep subsidy category in all these different programs of your work with the students? Did you say 700?
Yep.
780.
So I said 780 households.
Okay. Well, here's the thing. We have somebody that's come before us from outside the county for a proposal, obviously it's Prairie Point. And you gather from all that they've said to us that we're doing nothing, that we have done nothing, and here they're gonna come and rescue us from doing nothing in terms of subsidy for people in crisis. I think it's important to have this information that we are doing quite a bit, and we will continue to do quite a bit, and there are initiatives being considered to do quite a bit more. So I just think it's a little strange when we get this sort of message conveyed to us that we're doing nothing. I mean, that's what you gather from some of the Beacon stuff, I would say.
Thank you.
Oh, I think we're hearing today we do a lot, but there are waiting lists for all these programs, true, isn't that correct? So we're
That's
not,
correct.
yeah, so just wanted to make, even of people who are in that extremely low income category, we have people on the waiting list.
Correct.
So, again, to balance it out, we're doing a lot, but there's still need.
And I was just gonna ask, that pharmacy, are they doing okay there, or?
Sorry, that's a Bill question. I
Oh.
believe that they're doing.
The pharmacy, is it all right?
Yes, they are.
Good.
They'll probably be happy to see another building come
Yes.
online.
Yeah,
though.
I'm
Yeah,
sure.
more
Well,
people.
Yeah.
I know, I hope they
Right.
do good, yeah.
Julie, do we know the waiting list? I mean, to get to Commissioner Ulrich and to Commissioner Brecky's point from, we're talking about supportive housing, and I know we have a work session coming up, and you guys have been doing a lot of work to get at one of the board strategies. But is there a official waiting list for that, for some of these deep subsidy vouchers or the Section 8, so you'd know what this waiting list, how long that is?
Yeah, absolutely. So these programs are waiting list based, and the limitation of the waiting list is we only open them for a period of time. So for example, the Section 8 waiting list has not been open since 2007. So that doesn't really give a true picture of what the need is today, because there hasn't been new federal resources. So back in 2007, we accepted 1,200 applications. We still have around 100 people who are actively waiting on that list for assistance. For some of our project-based units, we last opened in March of this year and accepted for 2, 3, and 4 bedrooms. We get the greatest need for our 2 bedrooms. It's a couple hundred people who are applying during about a week time frame. And then also 3 and 4 bedrooms as well. I don't have the actual numbers here, but it's just that snapshot in time that we have.
Thank you.
Mr. Chair, if I could ask one more question.
Yep.
Julie, we've had the CDA and cities, and I don't know what degree the county, but work together to develop workforce housing. And in these workforce housings, it seems to me that they're right on the edge between deep subsidy and shallow subsidy. If you could comment on that, that would be good. And then the other thing is, it's my perception in these workforce housing projects, most of them, maybe I'm wrong on that most, but some of them at least have had to have 2 or 4 units that are for homeless people, or I don't know if it's very deep subsidy or what it is. But if you could comment, where does the workforce housing fit on this matrix, or this shallow versus deep subsidy? And then also, how many workforce housing projects have there been, and how many have required helping the homeless as part of that project? That's several questions wrapped up in that.
Sure. Mr. Chair and Commissioner Ulrich, thank you for the question, and it was a wonderful segue. So for the income limits, the answer is it's that very low income is the lowest end for these units, and then it goes up to generally around 60% of area median income, which is between the two, the very low and the low. So that actual number isn't on here. But if I can jump ahead to the workforce housing slide, I think I can help answer your question a little better here. So when we last had the comprehensive housing study done in 2016, the demand showed that we needed 626 workforce housing units between when that study was completed and 2025. We've been very successful and have built, and after next month, when the Willows opens, we'll have 293 units between 2017 and October of this year. In 2019, we were awarded an additional 123 units of tax credits. Unfortunately, we returned 64 of those as one of the developments was not able to move forward. But we do have 112 units that are pending tax credits. So if those applications would be funded, we would be at 77% of that 2025 goal. And then to get at some of your questions, Commissioner, you're absolutely right that these developments not only provide housing for our workforce, but they also are providing 53 units, 31 of which are deep subsidy for homeless households, and 22 are deep subsidy for disability households. And those are coming with services from partners like the CAP agency and other providers who will take families from a coordinated entry list, which is that first one-stop shop for people who are experiencing homelessness in our community, and help support them and stabilize their housing.
Yeah.
Julie, so
Mr. Chair, if I could ask one more question. I'm sorry to ask so many questions here.
It's good.
But it's my perception as I am liaison to CDA that most of these projects have asked for a significant contribution from CDA to make them go. You know, there's, I don't know if it's 100,000 or 200,000 or whatever it is, but it's a big chunk of change. And it's also my perception that the CDA's ability to keep giving these amounts of money is going less and less. Can you comment on that? How much has CDA had given for some of these projects? And I talk about the ability for CDA to keep throwing in contributions to these applications.
Sure. Mr. Chair and Commissioner Ulrich, thank you for the question. I appreciate it. In this area, I feel a little more knowledgeable than in our senior developments as Great Lakes manages that. So you're right, the CDA has invested around $2 million in deferred loans to bring these 293 units to our community. So it's around $4,000 per unit that we're investing. And the actual development cost has been $68 million. So we've really been able to leverage that $2 million to help really increase the supply of housing in our community. We used to take these on a case-by-case basis. And so prior to 2019, we would get a call from a developer that was looking to develop here in Scott County. We would consider that. And then the need became so great, or the interest became so great in our community, that we developed a formal program. So it's an INVEST program that's called, and the board has designated $300,000. Last year, our requests were up over $1 million for those funds. So it's going to continue to be a competition. The good news is once this program gets rolling along, those deferred loans will come back to the CDA. So the terms are 15 years. If the developer were to refinance for any reason, we would get that money back sooner. So over time, we will start to see this money come back, and it won't have to be new funds all the time.
On that note, sorry, rarely are those going to be refinanced, though, aren't they? Because your money's usually at 0%, or, I mean, very low?
Yep. Thank you for the question, Mr. Chair. So they are at the applicable federal rates for interest. Okay. The properties really are refinanced at the end of the first 10-year compliance period because the investor wants to get out of the deal.
Got it.
So they are typically refinanced around that 12, 15-year mark.
You had a question?
Thank you.
Sorry.
Julie, just on this deep subsidy, homeless and disability, so it looks like we have 53 units. Well, maybe 12 of those 53 are still under construction, it looks like, or?
Correct.
Yep. Are those, I assume they're full, and once the people get there from the wait list, they stay there, correct? And then if, as their income increases, they would pay, so it's not like these units turn over very often.
That is my understanding, correct. The good news that I've seen, Danielle Fox, I think, has shown some information, is that when one of these developments opens, the number of people on the coordinated entry waiting list, whether they're, you know, ending up in one of these 4 homeless units or not, it is impactful in being able to decrease the overall number of homeless households in our community.
Yeah.
So just increasing that supply of housing makes a big difference.
And that same idea is true whether, okay, you're in the first column, that if they make a ton of money or whatever, get a new promotion, a new job, whatever, they're not incomed out either. So they could stay indefinitely in that apartment, right? If they're making.
So I've asked this question of the tax credit developers because there's all kinds of rules, and it is my understanding that that is correct. They
Right.
could stay. But what I found in my experience is that, you know, people aren't any different, you know, and so when they can move on, they move on.
Yeah.
You know, and just because I can stay one place doesn't mean that I'm gonna stay there forever. And so I find that people, they want to move on, they want to achieve home ownership, and that's what I experience.
Yeah, and I only asked the question because, you know, I mean, you try to build, you can't build them fast enough.
Right.
There's always gonna be need, so
Yeah.
it's more of a how do you,
Right.
same thing with the money earlier, you know, how do you get
Mhm.
it to, you know, in this case, a roof for people that need it for a time. So that was just, I think I've asked that question and I just wanted to ask it again, just,
It's okay.
the answer was the same, so that's.
Oh, good.
Julie, do we have a data point on the turnover when they come in from the deep subsidy homeless or the deep subsidy disability? If they do turn over, do we know that rate on stabilizing and they move on when they start in that position?
That's a good question. I'm not aware of that currently. A number of these have just come online. It would be a good thing to be able to track that turnover. I think that would be
Be a good thing to track, yeah.
good thing to know.
But yeah, many of them just moved in the
Who
last
would,
2
who would we
years, so.
turn to track that? Which agency is responsible for that?
So of course you would have to partner with the, you know, whoever the owner of the development is, but really it would be your service provider, probably in coordination as well with your own housing coordinators here at Scott County, because they're working in partnership. When these openings are occurring, people are getting pulled off of the coordinated entry list, working with CAP agency who's placing them. So it's really probably 3 parties that are working together in that. Mhm.
And is it the building owner who alerts then, like, somebody moved out of this, they would alert CAP?
Yep.
Sorry, we're just trying to figure out.
No,
how this
I
all
love
works.
all of the questions. Yep. Good.
And we're still bound by, what agency is it at the state, where you have to have minimum counter space, you know, different square footage of things that seem kind of inconsequential to me, when you could potentially get more units in a building?
Correct. So the Minnesota Housing Finance Agency, they have building standards that come with their programs, which that is one of these. And on the flip side of that, you know, you want these to be good investments in your community and seen as real assets. I think sometimes, you know, that is a struggle for a community, and why we see more rental licensing going on, ordinances. You know, communities are kind of faced with, okay, how do we make sure that this property is maintained for the long term? So Minnesota Housing is trying to do some of that on the front end when it's being built, to preserve it for the 30 or 40 years of affordability kind of going forward.
Congratulations, you just talked me off the ledge.
Well,
But isn't Shakopee just entering into
neighbors don't want it if
a rental ordinance? I mean,
I
they're-
know, it's that,
So Shakopee, I think, is just starting up a rental ordinance, isn't it? I'm pretty
Oh,
sure.
they've had one in place, yeah.
But it's,
so yeah, Shakopee and Savage both have what are called rental registrations.
oh, yeah.
And so there's no fee that's associated with it, but I think some of those communities, I haven't seen lately what the conversations have been, but I would assume that they're talking about doing more licensing based on that.
You have to
it
go
might
through
be a
training.
good scale topic even to
Mhm.
talk about there, but there's some actively going on in Shakopee. I've been
Well,
following.
you have to go through a training, which, you know, even if you're renting one unit in your house, if it's a non-relative, you know, so there are some, you know, some hoops to jump through, but I think that's a great idea for scale to talk about all the cities.
So, maybe on this topic, maybe not, but I've heard it asked in meetings like this, that maybe people would open up more of their units to subsidized housing if there were some protections in place for landlords. And I've also recently heard that some individual homes that are in the subsidized rental are not behind because a lot of those renters were getting money from the federal government, enhanced unemployment. So actually where they, again, just anecdotal, often were behind are now not behind. So this weird change, is there anything that we can do to try to influence that? To try to open up more housing that's already out there? What do they call that? The NOAA? You know, so landlords aren't worried about having to pay a huge bill when people move out to fix whatever. I mean, I know there's always I don't want to imply that, you know, but there's always beyond the normal stuff.
Right. So there are about 800 property owners in Scott County. So one of the things that we do is we do a lot of landlord outreach and engagement. So help them understand our program and the benefits of being involved. We do regular inspections of their rental units. We make sure that payments are made to them timely. It's a third party who's able to help if there is an issue with a tenant to hopefully be resolved sooner. There is a program called Beyond Backgrounds. So if a landlord is not currently accepting a rental assistance voucher from the CDA, they could apply for that protection program that would, in the event something does go wrong, would have some funds attached to be able to protect their asset when somebody moves out. That program was in a pilot stage for about 3 years. It was just renewed by Minnesota Housing. And what they found is that during these 3 years, they've had a number of people who have been involved in the program, but they've never had to pay anything out. So just that comfort of a landlord knowing that something is there, that additional support for their rental unit is really great. And so I'm glad to see that Minnesota Housing is continuing that.
That's good. Yeah.
And then the last one in this area is the homeownership program. So really kind of transitioning through from that continuum. So we, in the end of 2019, launched the Scott County Community Land Trust, and kudos to Linda, who's been our team lead in here. She's done a really great job of putting that program together. We have our first applicant approved, and they're in the housing search. It would have been really great had they purchased yet, but the market is just really tight right now. But we're looking forward to that and to be able to celebrate with that. Linda has also put an application in to be able to expand that program by adding 12 homes to the trust. So I believe you'll find out by the end of the year if the application was successful or not. And then just a couple of other things. Our agency continues to provide first-time homebuyer education and one-on-one counseling for both people who are interested in purchasing a home as well as those who find themselves facing foreclosure. Really great results. I think 70% of the people who go through our program end up purchasing a home. Last year we started a workshop here in Spanish and had 25 participants in that program, so really excited about the partnerships that we've been able to create with Clues and NADA, and then have also created a similar partnership with the African Development Center to be able to provide that education in Somali, so we're excited about those things. Moving on from affordable homes, into cooperate with communities. So we've already touched on the first 4 bullets here. Stacy talked a lot about the business assistance work that she's been doing. You know, I think when I look at this, you know, it was great that the county saw the CDA as a trusted partner, you know, to be able to pick up the phone and partner with us on these CARES funds and to be able to help move that $7 million out into the community. Housing assistance, I believe, will be launching today. There is a state housing assistance program that launched the end of August. And one of the criteria was that you wanted folks to first be able to funnel through that program before you reached this program for housing assistance. So we will be launching now and should be able to help move that money in the next 75 days.
Great.
And then the last thing is supporting All People's Lives. Just the two things that I wanted to highlight here was Homework Starts with Home is a planning grant that we received for this school year. Molly Link in my office worked closely with Peter Goldstein, one of your housing coordinators, Barb Dahl, the broader Scott Family Net. And really what this is a grant to help within the school districts, they have homeless liaisons. And we're trying to be able to connect those homeless liaisons and the students and families who find themselves facing homelessness with our broader system. And that grant will help look across those systems, make those good connections so that you know, the families that are experiencing homelessness can get the housing and support that they need and stabilized so that the kiddos can get back to learning. So really excited about that partnership. And then the other thing I wanted to point out was we do a lot of work with your Health and Human Service partnerships with our various subsidy programs. So in addition to those 53 units that you saw that are designated within the workforce housing developments, we have an additional 55 households that are served through tenant-based programs. So you can see that those here support people with mental health through the Bridges program, community corrections, people who are experiencing homelessness, child protection through the family unification program, and then new this year we received funding for 13 households that will serve non-elderly disabled households. So really excited to be able to partner with your staff and help to provide those housing needs to those specific populations. And with that, unless there's any other questions, I'll hand it over to Bill.
All right, any questions? Thank you, Julie, appreciate it. Man of the hour, the man, the myth, the legend.
Just here to mop up.
The Dick Clark of CDAs right here, this guy.
There you go. I want to thank the county board and your administrative staff for the partnership we've had in 2020 and moving through these difficult times. As we get ready for 2021, we need to be prepared for more challenges. And I think the CARES funding partnership, and my hunch will be that there'll probably be more federal CARES dollars coming our way, and we'll really be set up well to administer. And as you say, Chair Beer, be able to get it out to the communities quickly and efficiently and with good checks and balances so that we don't have any double dipping. Before I jump in, I just wanted to comment on the pharmacy. Yes, it's still there. So is the clinic, although the clinic has remained temporarily closed. We did do a forbearance agreement on the rent that the clinic pays, and we're working closely with them. If anybody's been up in that area, you will note that as we're finishing up Brentwood Terrace, we're doing both parking lots. So we really want to sharpen up the entire drive-in campus portion, and hopefully as we move into 2021, things will start to return to some normal sense of balance. So we'll keep county informed as to progress on that. The four basic developments that we have on this roadmap, of course, is the Earths facility, and as you are all aware, we've made a low-interest 15-year loan to the county for this development, which is now wrapping up. And we also have Brentwood Terrace in Jordan and the additional 59 independent senior living apartments. That does require now $175,000 in additional annual debt service contribution by the CDA. So our 9th building, along with the other 8, all have various contributions on an annual basis that comes out of the special benefits tax levy. Workforce housing development, again, Julie did a nice job, I think, pointing out where we try to send levy dollars to support and leverage additional development in that area. And then the Elko New Market extension, and we are actually restarting the technical team conversations. I believe, Stacy, that's going to be the 23rd. So we're back into conversation with that. We hope to actually see that happen in 2021. And the estimated bond payment is what we have on the table right now is roughly $240,000. And the actual cost where we left off in, I believe it was July, I think, when we had our last conversations. Somewhere in that area. But the actual cost at that time estimated was about $4.5 million. The amount of the bond that we're talking about is roughly, I think it's 3.5. And so we're going to be revisiting where we're at with Baker Tilly and the administrative staff at Elko New Market, actually now on the 23rd, and keep that moving along. There's still moving pieces that need to come to the table. And if you have any questions on that specifically, I have Stacy here and also my financial director, Adam Johnson, who can answer any technical questions on that. So those are the four basic ones where levy dollars are going to. And our 2021 CDA tax levy, as you know, is tied to taxable market valuation. It's based on a fixed formula. And the increase for 2020 was $246,236. For 2021 is projected to be $247,351. So it's really elbow to elbow as far as the actual dollar increase from 20 to 21. And so that's where we are on that. And you have a CDA budget comparison here. And as you can see, our revenue and expenses. And again, if you have any specific questions on this, I have our finance director here who can delve into any details that you would like. And the budgeted comparative for 2021 and the actual expenditure of levy dollars is before you in a pie chart. And roughly it's not too unchanged from 2020. And on behalf of the CDA board and staff, we're thanking you, County Board and Administration, for your continued support. And we look forward to working as a team toward recovery in 2021. So with that, we'll take any further questions. And I have an excellent management team here with me that can certainly step in and answer any technical questions.
All right. Thank you very much.
Can I ask, and this maybe isn't you guys' purview, but you look at downtown Minneapolis, they had all that craziness going on. I don't know if you guys saw that in the news or not. Anyhow, there's going to be a lot of empty buildings and space down there. You know, and I know that that's not Scott County, but could some of that, like office spaces, be converted to living if people wanted to live down there? And like I said, I don't think this is you guys' deal, but
we actually went through an exercise like that with the Hamilton when they lost the school tenant, because the Hamilton has, actually our master lease tenant for the Hamilton is the city of Savage. And they initially had the Head Start in there and a number of school programs. So when that space vacated, it was floated, well, could you turn those units into, you know, living quarters? And we clearly took a stab at looking at that, and it was just so cost prohibitive.
Oh, really?
Yeah, it just really wasn't worth it. The remodeling was just way too excessive, along with other challenges. I mean, we'll look at anything, Commissioner.
Yeah, yeah,
But
no. Because there's gonna be, from what I'm hearing, a lot of available space.
well, we're aware of that too, and we still have a master lease tenant at River City Center too. And again, as we're moving through this COVID crisis, we've got to be prepared to step in and react where we can so that we keep everything moving along and continue to be successful.
Mr. Chair, just one comment, some good news, Bill, I don't know if you know, but the Jordan Clinic is open seeing patients again this week.
I did not know
Yeah.
that. That's,
I just double checked the
Excellent.
website, I was like, I think I got an email about that last week, so
no, I
that's
think
good.
that's terrific. And I
Yeah, we
think-
want people to go in and do what they need to do.
Yeah, and I know before the COVID crisis, they were planning on doing a facelift for the building. And of course, that was put on hold as we moved through the pandemic restrictions.
A facelift on the facelift on the building in Jordan?
On the clinic building.
Because that, what is that, 20 years old?
No, I don't think we're there 20 years. I think we're,
It's like, yeah, it's less than 10. How could we need a new?
yeah, I
Anyhow,
know, it
that-
hasn't been that long.
That might have come out of a.
I think it's maybe what, is it about 12 years?
Yeah,
Okay.
Yeah,
Okay.
with the Cavini
well,
drug or
there you go.
whatever, yeah.
My wife's still waiting on a new kitchen after 26 years, so let's
There
keep
you
it,
go.
Simmer down.
keep it under wraps. Time-wise.
Mr. Chair, I just wanted to add that we, our staff have commented several times who are in the lead on this COVID about the partnership with the CDA and their actual understanding and having paid attention to some of your board meetings on what was very important to you, and you folks got to make the decision on those policies from mortgage and keeping people from losing their homes, those foreclosures being very important, to understanding though that they were current in using their unemployment plus, to the businesses. I mean, both Julie and Stacy understood, and that hasn't always been in some of these discussions with other agencies, but they clearly understood your points and have tried to work to make those programs reflect what your values were and your policies. And I just want to say thank you for that, because I've heard nothing but positives from Chris and Lisa and Jen on trying to work through those things. So thank you very much for that as well.
Well, and I,
Mr. Chair, if I could
yeah.
make a comment.
Yep,
So as liaison, I get to the CD, I get a close look at their work, and I would have to say that one of the biggest success stories within Scott County is the work at CDA, whether you're talking about housing for homeless, economic development, support of fish. They're just doing stellar work, and I'm really proud of the CDA and all they've accomplished. And as liaison, I hope I would like to make the motion to approve their budget and levy, and so I'll do that.
so we have a motion.
Mr. Chair, I'll be seconding the motion, but I do have a question under discussion.
Sure, we have a motion and a second, so let's move right into discussion.
Thank you, Mr. Chair, and for, maybe, and I don't want you to plow real deep, I just want to, have a brief explanation about, why 7%. You know, the CDA has done a good job of listening to the thought, the attitude, the values of the board, and working with us, has been referenced already. And I echo Commissioner Ulrich's, sentiments about how well they work in accomplishing the things that are important to us. But surely they've been listening as we've been pressuring our staff to hold our levy increase, you know, in the 2 to 3% range, and now we're seeing 7%. Now, admittedly, it's 7% of a much smaller number, but am I given to understand that the explanation was on that last slide that Mr. Jaffa showed, where the perhaps the new bond payments and a couple other things that were coming up are contributing to that part of that 7% increase. Is that what we're looking at here?
Correct.
Yeah, that's the slide rate. 175,000 in new payment for Brentwood and an extension of a $240,000 payment for Elko.
Correct.
So I answered my own question. I heard him say correct.
Correct.
Mr. Chair, but isn't it true,
Well,
Bill?
Mr. Chair, I appreciate the brevity because all the other answers have taken 18 to 20 minutes. Brief discussion is appreciated.
Sorry, I'm gonna wreck that, Mr. Chair, but Bill, isn't it true that when you propose your levy, you use the formula that's provided by the state and you're
Correct.
giving us what the maximum levy you can?
Right, it's a fixed formula, and, you know, should market valuation go the other direction, well, then the levy would go the other direction. And the wisdom behind the formula in the statute is that, you know, if valuation continues to increase, well, needs are going to continue to increase, which means the need for housing, economic development assistance, et cetera, is going to increase as well. But it is a fixed formula, and there is no real up or down. It's there. So we don't have general taxing powers, but we try to give you the biggest bang for the buck we can.
Thank you.
Well, I'll kind of jump on what Leslie started is, you know, I've always mentioned that it was always just this weird, like, wait a minute, we have to approve your levy, but we don't really have any, I mean, we have a liaison, we have our commissioners, or I forget the term, but I do feel like this year there's been a little bit more of like, hey, we are singing from the same hymnal here a little bit more. And that's not necessarily, it's just because we're, I don't know, partnering better, whatever. It doesn't feel quite as bizarre. It's still a little bizarre, but not quite as bizarre it has been, because it does feel like we're, you know, working together. I know that we were, but it just feels a little bit closer that way. So thanks for that. The only other thing is 55 plus. Is that considered senior housing? 55 plus?
It is.
Because I got to tell you, there was a time in my life when 55 plus seemed, long ways away. Not so much anymore. So let's call it junior housing. Can we call it junior housing now? Because it'll be coming close.
We don't quite qualify.
Yeah.
And what we understand too, when the opportunity presents itself, although it's going to be restricted, really on how we, you know, have an open house, from what I understand, the views are spectacular from that building, and being at 63%, I think is a huge plus.
It looked good when I was flying through 169. I took a look up there. I'm like, it looks good. Of course, at 80 miles an hour, I was going.
Yeah, you can go 90.
Maybe, no. So thank you. All right, we have a motion. We have a second. Any further discussion? Looking left and right, looking online. My two screens, not seeing any, and Deb is ready to pounce.
Bill, you gotta move.
Yeah, if you want this thing approved, you gotta relinquish the mic.
Commissioner Weckman-Brecky.
Aye.
Commissioner Wolf.
Aye.
Commissioner Beard.
Aye.
Commissioner Beer.
Aye.
Commissioner Ulrich.
Aye.
All right. Thank you, everybody. Nice work.
Don't wait.
All right, sounds good. We're going to move on to 9.1, adopting resolution number 2020-139, establishing a maximum proposed levy of $78,877,211, less $5,962,211 for certified property tax aids, for a net levy of $72,915,000 for the purpose of preparing the 2021 proposed property tax statements. Danny.
Good afternoon.
Wait, I was going to say good morning, but good afternoon.
Good afternoon, Mr. Chair and Commissioners. I am here to talk about setting our preliminary levy, and just to kick this off, the levy we're setting today is the maximum levy. From this point onward, it can only go down.
Can you say that again?
This is the maximum levy we're setting. From this point onward, it can only go downward. So this is setting the cap for us for our proposed budget.
So it fulfills the statutory requirement of getting this number out.
Yep, and so we do have to do this by the end of September. This is our last scheduled board meeting, which is the reason we do it at this point, but it could go until the end of September until we actually have to approve this number.
And we're still hoping and praying for what we're.
Well, and as we'll talk about, we are not just hoping and praying, but planning to come in lower than this. So just to give you a little bit of an update on the calendar, we are setting the preliminary levy today. On October 27th, we do have another budget workshop, and then with November 21st, we have our board planning workshop where we'll give kind of that final update on the budget before we have our December 3rd date for our proposed 2021 budget and tax meeting, which used to be called the Truth and Taxation meeting. And then we plan to adopt and certify the 2021 budget and levy on December 15th. So when we go into building the budget, we have some guidance that the board has long provided us that we use in order to, as kind of the guiding principles. Long-term fiscal stability while minimizing tax impacts, reasonable level and constant tax burden, focused on modeling limited and relatively level increases, managing limited resources over unlimited demands and provide the level of services necessary to meet mandates and citizen expectations. Try and maintain fiscal stability. That means a structurally balanced budget, maintaining our county reserves and fund balance, maintaining our bond rating, planning and preparing for the future, and then of course don't spike the levy and try and keep surprises to a minimum or actually none if possible. This year obviously was an outlier for us.
Something going on, or?
Just a couple of minor things.
Got it.
When we talk about fiscal stability and that structurally balanced budget, there's really three components to this with an asterisk under one of them. The budget and the levy, what does it mean to actually be balanced there for a budget, expenditures meeting revenues, and then maintaining that levy and what we believe to be sustainable and living within our means as an organization. Historically, we have defined what living within our means is as new growth plus inflation. And so that's where we always have as our starting point for the budget and try and adhere to that as closely as possible. Then we look at the needs of our taxpayers, clients, and staffs. What are their expectations in terms of the services we provide, the facilities we offer, and the costs that we really have on the taxpayers. And then we have that third kind of square there, the quality of programs and services. And so this is both about achieving the goals we set out to do, but also meeting the mandates that the state has put on us in terms of delivering those services. So when we say quality of programs and services, it's both the areas that the board has control over, and sometimes a little bit more frustratingly, the areas that we are mandated to do things and have to make sure we're continually doing those. This year actually was a little bit less in the new demands areas, but I think we've seen in the past, and it was alluded to earlier, costs of out-of-home placement, which we are mandated to do, and have to continue to provide those services to the organization and the public.
I'm seeing a raised hand. Is that intentional? Commissioner Beard?
No.
Otherwise, obviously jump in anytime, but. All right.
I believe he's muted from what I can see, so he may be asking a question.
I'm seeing a mute as well. Or he's giving me the hand of like,
Well, I'm happy to go back if he's
Okay.
able to unmute, and we do have a question there. So going into the budget, we had some goals that we had in place. That we do have contracts for our unions that we just actually wrapped up at the end of last year. And so that includes salary and benefit increases that are now legally bound by contracts. Maintaining our critical operations, keeping the levy increase to a minimum, and then implementing a multi-year budget reduction plan to meet the fiscal challenges we have. The things that we're able to fund in this budget is we are able to maintain the county's current compensation strategy, keeping employees competitive with the market, maintaining capital while planning for the future, funding for our financial system replacement, which is coming up in several years, and we're slowly building up the investment into that. And then also including software implementation that are moving from capital expenditures into our ongoing operational costs. Funds required expenditures for buildings and contracts that we have. We have new building operating costs coming on board. We have managed services for our IT managed services vendor coming on. And then we also have treatment court coming off of grant funding and coming fully onto the levy funding, which is all included in this budget. We've also cut significantly within here. And while they are going to have an impact that we're going to feel in the organization, we do believe that all are sustainable reductions included in the budget. Most critically, we do maintain our critical operations and services to the residents of the county. So to talk a little bit about some of the things that were done going into this year, we already knew it was going to be a difficult year before we even had COVID or any other things impacting us. When we were here at this point last year, we were looking at a 3.71% levy increase to start us off before funding any requests. We have very little, if any, easy areas to cut. We had 0% negative levy during the recession from 2008 to 2010-12 timeframe. And even after that, we had very minimal increases going forward. We've had few items added over the years, and frequently those items that were added were from direct growth in demand or reorganization and repurposing of positions. As something had less work, we repurposed that in order to meet the new and growing needs. And I'd say staff has gotten very creative to meet those needs without requesting positions across the org. Also, the approach to budget has consistently eliminated capacity within the department division budgets. End of year savings are targeted for repurposing into departments that see additional need. Vacancy savings that are within the budget are expected to cover almost 2.5% worth of levy, or 2.9% of the operating levy, which is one of the areas that hit us hard this year when we didn't have those positions turning over as quickly. And this is what's made it possible for our levy increases to remain low over the years. We also haven't let the department off, the organization off easy though in this time period to really look even harder at areas where we can cut. For 2021, as we saw our projected deficit, the departments worked hard to eliminate that by offering up things that we could go without for this year. 1.2 million in reductions were made to make up the shortfall. And the shortfall is really driven by revenue losses and lack of that job turnover like I talked about. For 2021, we actually asked departments to provide us $6.6 million in reductions that were identified through this process. Getting to this target would have required the elimination of over 35 full-time positions, and it's likely not achievable in 2021 without significant disruption to services based on some of the things that were offered as potentially feasible. The board did approve, thank you very much, a multi-year reduction strategy. This would allow us to cut some in 2021 for the 2021 budget, utilizing either one-time dollars or one-time cuts in order to look at the rest of the reductions to be made in 2022. That did work, assuming revenues would come in close to projections. We were able to make cuts of opportunity or that are less painful for 2021. And we have identified and began work on changes to businesses for the 2022 budget gap. We are planning on a 1.92% final levy when we come back in December for what that proposal is going to be. This budget is built on that 1.92% as our final levy already. We have not been building on the higher number, but we'll talk about that in a minute. That 1.92% allows us to keep services at a sustainable level while reducing costs. It meets our union contract obligations and keeps Scott County a competitive employer. It meets our financial obligations and keeps us on a steady path for the future. Our debt's funded, we have a healthy fund balance, and levies on a sustainable path with no spikes needed. It also provides contingency options for the unknown. The CARES Act funding for salaries has become more uncertain as we've gotten more guidance from the federal government. Property tax revenues may decline as federal support for residents starts to wane, and CPA reductions could come later in the year with little time to adjust. Primarily for that CPA reduction reason, as well as those other things that could impact us, we are proposing a levy for today, for the proposed levy, and again, sets the cap, not the floor, of 2.52% in case of potential state actions. This proposed budget does represent that 2.52%, but we already have plans for either fund balance or one-time reductions to make up the difference to get to that 1.92%.
And the 192 again is the
New
growth,
construction.
not growth plus, just plain old growth.
Yep, new growth.
Just, yeah.
We also have already started looking out in 2022. We have a good work plan in place to identify business operation changes, and some work is already well underway. Low or no impact savings have already been identified for 2022. We have a bond refunding, which you actually just authorized the date of today's board meeting. We have potential savings from paying off the medical examiner's facility early due to some OPEB savings becoming available early. And then we've already started looking at paying off the IRTS facility costs, which all those together would equate to between $500,000 and $540,000 in operational budget savings for the 2022 budget. We do have OPEB savings that are already incorporated in the future that are going to, savings that are, when we move our savings from the OPEBs to cover our bond payment, there's about $500,000 left over that we don't need for that bond payment. That's already been incorporated into that 2022 budget number, helping to bring down that levy a little bit in an area where we're already in a good place. We do still have short staffing in areas that are a concern. We've had some requests year after year. We do have the final year of transitional funding for the treatment court. Operational funding for CIP projects still need to be incorporated into the budget, into the forecast. And the expiration of the sales tax weighs heavily on the forecast, particularly in 2023. So what do we have going into the 2021 proposed budget? And what I will say, just coming into this, there was very little that came in as new requests for this budget year. A lot of this has been long included in the forecast based on decisions that were made a year, 2, even 3 years ago that we have incorporated into the forecast. But these are the things that are changing and coming on board for this year. So we have the new building operating costs coming in about $335,000 is our estimate. Managed services for our IT contract, bringing that fully onto our operating budget. Funding the treatment court for about $200,000. Our 5-year plan to bring on the financial system replacement dollars without having to spike the levy for $187,000. We have a fiber audit coming on board that's about $50,000 for next year. Software licensing costs, and these are from projects that were priorly approved in CIP that are moving into the operating budget for about $50,000. We had some mandated HHS program increases for about $26,000. Medical examiner cost increases for $22,000. And then our debt levy adjusted, and it's just based on how the debt schedule is, for about $85,000. In addition, those contracts that we have for salary and benefits equates to about $2.4 million in increased costs. Utilities, postage, insurance for $167,000. Our grant expenses, these are things where the state gives us money and then we expend it on their behalf, went up by about $1 million. And then we lost revenue, and we're kind of counting that as an expense here of about $1.4 million in our operating budget. So our total increased expenses are $6.35 million, almost all of them from things that are, 1, outside of our control, or 2, that were made from decisions either a year or more ago that are impacting this. So budget reductions and how we're covering that gap. To offset the grant expenditures, we had a little bit over $1 million in grant revenue that came in. Almost $1.2 million in budget reductions that were offered up and essentially incorporated into this budget from our divisions across the organization. About $117,000 in discretionary services reductions, those outside organizations that we provide funding to. $705,000 from reduction in state aid maintenance projects to offset that lost revenue that we're seeing there. And then we're planning on about $475,000 in one-time reductions for 2021 for this budget, and $1 million use of fund balance for 2021 as well. So the total reductions in revenue equate to about $4.56 million, which leaves us with a $1.79 million tax levy increase for 2021, or 2.52%. We're in the process right now of firming up and re-identifying those one-time budget reductions. Steve and I did some work on this, and we think they range anywhere from about that $475,000 up to about $900,000 in ones that were previously identified that we're rechecking with the departments to see if those can still materialize. So it's a little bit different way of looking at the proposed budget. We have our expenses and what are going up, and these are kind of combined areas. Salary and benefits, the increased funding, those inflationary expenditures and the grant expenses, and then offsetting it with the ongoing or one-time budget reduction expenditures. Our projected changes to expenses then, when you take all those things into account, are about $2.45 million. Our revenue, though, is the part that really kind of hurts us on this one. Our grant revenues did increase, but our revenue loss more than offsets those increases. Use of one-time funds as part of a revenue here gets us to our total revenue increase of only $0.65 million when our expenses are $2.45 million in increases. So that projected gap again is that $1.79 million. So when we look at our 2020 levy of 71.12, add our $2.45 million in expenses, less the 6.65 million in revenues and transfers. That gets us to a final levy of 72.92 million for a 2.52% increase again. When we look across and where this funds are, our operating budget's going up by about 1.709 million for a 2.98% change. Our capital debt's going up by about $84,000. This is that change in the debt service. Our capital funding hasn't gone up this year, and our road and bridge levy hasn't. It's all in that debt levy. So that's a 0.6% increase. You add it up, it's a 2.52% increase because those are different numbers that we have as denominators there. Any questions so far? So one of the things we also do here is always look ahead at our 5-year financial forecast. Things included in there are total rewards, salary benefit growth estimates, again, based on those union contracts. Additional debt service, so jumping up from our current debt levy in order to fund the building. And that isn't an increase in the debt levy, it's a reduction in our operating levy and shifting those funds to the debt levy. The medical examiner facility and the IRTS facility is still included in our operating budget projections. Funding of the treatment and veterans courts is included in that 5-year forecast. Technology updates and inflationary cost increases are included. So this is a look back a year. When we started out in 2021, we were projecting a 3.71% increase, with then those increases leveling off in the out years. And you'll see we're at 3.22% for 2022 budget. If you look now, 2021, we're at 2.52%, and we're actually under where we were for the 2022 budget at that time because of the work that's already been done. When we come in at 1.92% at the end of this year, that number for 2022 will go up a little bit though, just because it's building off of a smaller number, so the growth is going to look bigger there. Does that make sense? But even this, except for 2023, puts us on a fairly stable financial path, and that 2023 is largely driven by our assumed retirement of the sales tax, but it doesn't reduce the expenditures in the budget just because we don't have decisions on those things yet, and we try and incorporate those things that we know are coming forward at this point. We look at our operating budget.
Mr. Cook, can I just ask, so that half cent disappears after the 2022 and you've not added it in here?
We have incorporated the levy that would need to be increased to fund the operations that are currently being funded by that sales tax.
So there's about $500 and some thousand that goes to the operation of SmartLink for that weekend and evening that has continued to grow since we've started it. That was an identified gap in our service. And so that shows in here as shifting to the levy in 2023 when the sales tax goes away. That's why that jumps up there, Commissioner.
So for our operating budget, we do see that orange line kind of on a steady trajectory up. It's not any spikes or significant increases. While the full dollar amount does increase significantly over a 5-year time span, that is really incorporating those smaller percentage increases year over year. The purple line up there by the operating budget is our percentage of fund balance coverage for all of our expenditures. So you take our fund balance, you divide it by our operating budget, and that's the percentage of coverage we have for those expenses. Our actual fund balance dollar amount is this green line here, and we see it jumping up for 2021. This really assumes that we have some costs that are covered out of those CARES Act funds, which we've talked about in the past. And then that turquoise line, which is a new color my son has apparently learned somehow, is our cash flow coverage. So as we cover the grant expenses we have to pay out, we cover payroll before we get our tax revenue. This shows kind of the minimum amount we want to have to cover our cash flow to be able to make payroll, make expenses. And we don't want that in our 5-year forecast to drop below 5%. So going back all the way to the beginning of the presentation, where we talk about preserving our fund balance and making sure we have good coverage, I think we're in a good position with this budget within our 5-year model to not be in a strain where we're not going to be able to make payments on anything. And then included in the budget and fiscal modeling, the CIP is flat over our 5-year modeling. The tip is flat over our 5-year modeling. We see that debt levy jump up a little bit in 2022, and that is the building fund. And again, I just want to reiterate, that does not mean that there is a tax increase to fund that building. We are shifting costs that are funds that are currently available in the budget to fund that have gone away because our OPEB is fully funded at this point. So, fiscal stability, don't spike the levy, no surprises. You can see over the past 7, 8 years, we've been hovering right in that 3-4% with where our levy really comes in. And this continues that trajectory. And as we saw in the model, we're still in that path to be between 3 or 2.5% and 5% there to keep those levy increases steady. And that's what helps us prevent those spikes that you might see in other counties, is that kind of steady increase instead of those big jumps that we have elsewhere. And just to point out, this 1.92% here is our new construction with the 0.6% as our inflationary factor.
That's what the CPI was? Is that what you're saying?
Yep, 0. So we take a snapshot of what the number is in July, so we use a consistent number each year, and it was 0.6% year over year for July. So how is this proposal going to impact the residents of Scott County? From 2016 to 2020, we've gone from 36.19% for our tax rate down to 31.02%. And really over the last 8 years, we've declined almost 10% in the overall tax rate for Scott County. Sorry, I got to catch up in my notes. On the taxes, the value changes are going to drive most increases for residents. Home with 5% or less in value increase will generally see decreases in the county portion of their taxes. On average, with a home with a taxable market value increase from $318,000 to $332,000 or 4.4%, we'll see a decrease of $10.36 or 1% after value exclusions. This also kind of shows how the distribution impacts of what property owners are going to see, or residential property owners are going to see. Over 18,000 are going to see a reduction of from $10 to $49, and 5,000 from $50 to $99. So what this equates to is approximately 60% of our residents, our residential property owners, will see a decrease in their taxes, with about 40% seeing an increase, the vast majority of those it being less than $50 in that increase. This shows our county tax levy per capita. It's jumped up just a little bit by about $11 from 2018 to 2019. We do not have 2020 numbers built in here. That number comes out in November, so that'll be updated for our Truth and Taxation meeting.
Danny, is this using the 1.92 or the 2.5? Oh, no, this is
from
2019.
2019.
Sorry.
These are our kind of indicators of how we've been in the past, and I think this continues us on that trajectory.
Thanks.
And I'm going to skip this one. So one of the ones we look at and really want to keep pushing down is our county levy as a percentage of total personal income for the county. You can see historically going from 2015 to 2019, we've gone from 0.79% of the county, Scott County's tax levy as a percentage of total personal income for Scott County residents has gone down by 0.04%. For all communities, when you look at the schools and every property taxing entity, it's gone from 3.04% to 3.12%. There was a pretty significant dip down after 2016 though. This is one we look at because this means that people are making more money and increasing their personal income faster than we are growing their taxes. So we want to constantly see that number either hold flat or tick down each year. That kind of is a good indicator of us that we're living within our means as well. So with that, and I'm happy to stand for any questions, we do recommend adopting Resolution 2020-19139, establishing a maximum proposed levy of $78,877,211, less $5,962,211 certified property tax aid for a net levy of $72,915,000 for the purpose of preparing the 2021 proposed property tax statements.
Thank you very much for putting that all together for the fine folks of Scott County to have access to. Are there any questions from here? We've obviously workshopped this and wrestled through it and arm wrestled and wrestled some more, and really can't wait for October 15th or 16th or 17th, see how that all works out, but I like the idea of keeping our growth. Any questions from here or online?
Chairman.
Zoom. Yes, sir.
Mr. Chairman, to make the motion that we adopt resolution 2020-139, establishing the maximum proposed levy of $78,877,211. And I'd like to just make, if it gets a second, I'll make a quick comment, if I may.
We have a motion.
Second.
We have a second. And discussion and comment.
Mr. Chairman, I just want to thank staff for hearing our concern, our vision, our value that we hold the line on the increase in the levy and the increase on the tax rates, which actually have gone down a bit. They've heard that, they've squeezed the budgets, they've held the line. I just want you to know how much I appreciate that. And I'm sure I speak for about 33,000 people that I'm privileged to represent when they would say that. So, thanks for the good work.
Thank you.
It's a good comment.
Yep, agreed.
Try and do what we can to arm wrestle this thing down. So,
Can I make one comment?
yes.
I kind of don't even want to make it, but I see it every year on the Facebook. You know, the county, they're raising their levy 2.5, the school's doing 4.6, the city 3.1, and others, and they come, our taxes are going up 13 or 14%. That is not correct. It just, that is not correct. It's more complicated than that, but it's probably around the 2 or 3% if everyone just did that, so. And yeah, look at when you get your tax statement, it says it comes from the Scott County Department of Taxation. And the top line is, I believe, the county, then the next is the city, then the school, and then they have some levies, so. Just take a look line by line, is what I would tell people, and just look over, see where your money's going. I think that's a good thing.
It is. And I think we're on year 2 of really trying to hammer that home with the insert.
Yes.
Of trying to explain that, yes, we have the good fortune of having our logo loud and proud in the upper left, and you get to write your check if you're still doing that to Scott County. We are the collector for all of those lines on that tax statement. So I think it is helpful that we keep banging that home that we're the collector and we're responsible for the one line item. So check out the insert.
You are all aware of this, but this is part of the reason that we include the tax rate and the percentage of total income and the tax per capita in here, to try and give some other indicators, because Minnesota does have a unique tax system that we can't really clearly explain. Just because our levy is going up doesn't mean that your taxes are necessarily going up because of that.
I will just say that's the most polite way I've ever heard that put. Minnesota has a unique taxing structure. I've heard it characterized other ways. We have a motion. We have a second. This is setting the maximum levy for statute, and we're working really hard, and I appreciate that. I'm still going to hope and pray, because why not, that you're thinking that we are still have a very good faith way of getting to that growth number, which is awesome. So with that, we'll look to Deb.
Danny, you need to step off.
I know, everyone gets that microphone like, hey.
Oh, they just don't want to leave over there.
Karaoke is up next.
Commissioner Weckman-Brecky.
Aye.
Commissioner Wolf.
Aye.
Commissioner Beard.
Aye.
Commissioner Beer.
Aye.
Commissioner Ulrich.
Aye.
All right, thank you very much. And all of that data, that's online. I mean, we'll have the stream, but if anyone wanted to see all those,
This entire presentation.
because it all kind of, with your discussion is very helpful. All right, we're going to move on to item number 10, committee reports and commissioner updates. I will look down to my right. Commissioner Weckman-Brecky, please.
Thank you. Our last board meeting was September 1st. After that meeting, we had a workshop where we discussed the building project and the budget. On September 8th, I had my monthly meeting with the county administrator. September 9th, I had Scott County Historical Society board meeting, And then that evening, I attended the road turnback meeting for Mobile Manor Drive at Jackson Township. Our staff did a great job. I felt like the township is already well informed of what's going on, brought along. It was definitely the easiest road turnback meeting I've attended. September 10 in the morning, I was able to participate in the AMC Policy Committee seminars. Unfortunately, I had to sign off and miss Commissioner Beard on his panel on those meetings because we had the Three Rivers joint board meeting on that day, September 10th. September 11th, attended the SCALE meeting by Zoom, and then we had our ribbon cutting at 169 and 41, and that interchange is opening as we speak, so fully functional, and there's still work to be done throughout the fall, but it is opening today, right midday, I think. So you can go drive the Diverging Diamond.
Right.
I was just one of these evenings this week already was coming back from a meeting in the southern part of the county and on the phone, not in my ear, but like speaking to me, one of my kids is like, "Where are you?" I'm like, "It's just like I'm flying over
Oh, yeah.
78 and
Yeah.
41 here. It's kind of fun to
Yeah.
finally be driving it."
Yep.
September 14th, I think that was yesterday, I spent the afternoon in committee meetings for the Health and Human Services Committee of AMC. Have meetings again on Thursday and Friday. This is our policy week in lieu of our policy conference, really looking at for all Minnesota counties and Health and Human Services, what the biggest concerns and legislative priorities will be next year. I think it was pretty unanimous yesterday, and what we'll be working towards is really, really concerned about the waivers that are in place right now for so many of our programs, what happens when they expire, which are the ones that we really want to work hard with, either on the federal or state level, to make sure that they stay intact, at least in some level, even to offer some flexibility. And then the second thing, and we've said it here, and Danny Lentz has talked to us about this, and we're in this budget and levy being prepared for it, but everybody's concerned about cost shifts in the next year, especially in Health and Human Services. And really, I think from the county perspective, we all want to be so aware, be following what's going on in the legislature, and make sure that our delegation understands the impact and what the impact could be to property taxes if they do that, because as in the past, it would be programs that were mandated to do, and it's just we would lose funding for doing those. So not even talking about new programs or things additionally that should be done, but really it's in preservation and protection mode is what we're looking at this next year. That was yesterday. This morning, before this meeting, I met with our Health and Human Services Director for our monthly meeting and talked about a few of those things and other things going on. That's the end of my report.
All right, thank you very much. I'm gonna look down to my left. I don't see him, but he's on Zoom. Commissioner Beard.
I'm here. Thank you, Mr. Chairman. On the first, I participated in the workshop, as Commissioner Weckman-Brecky just mentioned. On the third, we had a transportation committee meeting, a virtual meeting, of course. On the 8th, I participated in the virtual community action board meeting. We talked about our budget for the next year and how things are coming together, which, by the way, are quite nicely. And on the 10th, as Commissioner Weckman-Brecky mentioned, I had to miss the Three Rivers get-together because I was one of the panelists on the AMC panel discussion on how to approach the legislature during an extreme budget crisis, which appears to be what we're going to have this year. So I think the takeaway from it, there were probably three things. One was they'll ask the legislature not to cut county program aid. B, don't dream up new programs to send to us to do and things for us to do because they're just, we're stretched with what we have. And the third thing is, as this COVID-19 quarantine has pointed out, there may be better ways to accomplish what it is we need to do. And some of the waivers have proven that. So we're asking them to make intelligent policy discussion and decisions that can allow us to do things differently than we have in the past. Continue for service that's necessary. Maybe some cases, the levy isn't as strenuous as we once thought it was, but to allow us to be creative and continue the waivers and maybe extend them to other areas. Mr. Chairman, that's the end of my report.
Thank you very much, and thank you for representing not only our county, but all of our counties in that good work of getting that news across. Commissioner Ulrich.
Yeah, all these meetings are Zoom except one. September 3rd, my monthly meeting with Elizabeth Mann. Later that same morning, the Scott County Transportation Committee. There are three topics that were of significant concern. We have many more topics, but these I'll highlight. The Metropolitan Blue Ribbon Commission, the Governance Commission that the governor announced that started at their first meeting on Monday. There's a feeling amongst many that the task they put before themselves is impossible to complete by December, so some are wondering if that has a predetermined outcome. That's a cynical view. I don't know if I hold that, but it is a concern. The next is the regional solicitation. There's a chance that we may not really get a project in the direct regional solicitations. They're going to be working on that. The 13 Dakota Yosemite, the freight project there, as it's known, is behind. So we've been concerned for a long time. I think I able to complete that project in time for us to use the money we received. Federal funding, that's still a big open question, so we're concerned about that. Later that day, same day at the Fish Executive Committee, on the 4th, Scale Executive Committee, we talked about upcoming meetings and how we're going to have a candidate forum in the future and some sort of award program for great scale efforts. We talked quite a bit about the vacant data research analyst position. The person that left that position, it was sort of surprising that they left, and the general recommendation was to not fill that position at this time, and that recommendation was not necessarily received well by all member cities, and it's going to be discussed more at the upcoming services delivery committee, and many wanted to see that position filled and not lose the momentum. But it is a split opinion. On the 8th, STA, and we spent quite a bit of time talking about the Blue Ribbon Commission and developed talking points. The 9th, I met with Connie, and I'll have to have help on pronouncing his last name, but Connie is one of the appointees to the Blue Ribbon Commission. Lisa Fries and I met with him for a couple hours to discuss that. On September 10th, our second Thursday meeting for FISH, we had the student survey and the COVID update. Later that same day, the joint meeting with Three Rivers Park District. The 11th, Scale, we talked about legislative priorities at Greater MSP. And later that same morning, I had the IRT. I had to actually leave the Scale meeting a little early, go park in a parking lot, and leave our RTF meeting using my phone as a hotspot. It was a technology morning for me, and then I joined in live with the ribbon cutting and watched two of our commissioners do a great, excellent job. Commissioner Beard emceed and did a fabulous job. And Commissioner Brecky also did a great job as well in their presentations at that event. Proud of them both. On the 14th, STA, we had another meeting about the Blue Ribbon Commission, and I sent you all a link where you can get notices of all those meetings of the Blue Ribbon Commission, or you can listen in. I think they're also going to be taped so that if you want to watch them at your leisure, can't watch them live, that option is going to be available. That's the end of my report.
Thank you very much. And this dawned on me probably yesterday or the day before, because I see you a lot on Zoom. We see each other. We're doing a lot of Zoom meetings. But it was a pleasure to see you at the ribbon cutting, live and in person. Yeah, but it didn't dawn on me right away because I see you on a regular basis just on Zoom. So I wanted to say that. Commissioner Wolf.
Thank you, Mr. Chair. On the 9th, I had Newmarket Township and Cedar Lake Township for their monthly meetings. Then on the 2nd, Credit River. On the 3rd, Prior Lake, we met as board chairman, and myself, the administrators, a couple Prior Lake City Council folks, the mayor and another. Talked about a couple of projects that are coming on. And then on the 8th, the Prior Lake City Council met, talked a little bit about their budgeting that evening. On the 9th, the Metropolitan Emergency Service Board met, went over the levy there for that. Another Credit River meeting that evening. And then incidentally, on the 28th, there will be a Credit River meeting that will, they're gonna talk about the becoming a city. So it's gonna be a thing for residents. Then on the 10th, I-35 Solutions, we went over the Orange Line. There was a nice presentation showing the, the Lake Street, there's gonna be this great big station down there, and it's really gonna be first class down there. So one of the worries now is that not a lot of people are taking the bus and going downtown, they're working at home. So, but I think as time goes, that'll all come back. Then we had the Three Rivers meeting that after that. And then Elko New Market had their one of their twice monthly meetings that night, and Spring Lake also met that evening. On the 11th, the scale meeting, the ribbon cutting right after that. With the Elko New Market administrator about a couple things that are coming along. Talked to our county attorney about the helipad, which came to the planning and zoning here last night and ended about 11 or so o'clock. It actually got tabled. The couple of planning and zoning commissioners thought that there maybe just have a couple more, restrictions just to make sure that everything's tightened up there on that deal. And otherwise, it looks like it'll go through at some point, but they just want to make sure they have everything sealed up a little bit so that it doesn't get crazy out there. So that is my report.
Thank you very much. Got a lot of duplication here. 9-1, the building budget workshop. 9-2, monthly administrator meeting. Was good to we meet on a regular basis, but this was a little bit kind of getting back on track, which was awesome. The third, a Prior Lake quarterly meeting, as was mentioned, MESB on the 9th, Fish on the 10th, Three Rivers on the 10th, Scale the 11th, and then the ribbon cutting on the 11th as well, which, I mean, you mentioned, flying over that interchange is how nice that is. I remember coming down 18 from 494, single track, part of it dirt, had to go to the bridge, Bloomington Ferry, which part, now this part I missed. Then I remember, because I lived in Savage at the time, and hey, we're closing the road. Water's getting too high. This is the last of the afternoon for a while. And you'd get down to the flats and you'd be over the water, and hey, there went a fish. I actually brought a fishing rod one time and cast it out as I've been driving down the. Then I remember 169 kind of got opened up, but we had stoplights at Anderson Lakes, and what was the other one? Pioneer Trail, and oh man, 494. How do these guys build this thing with these stoplights? Unbelievable. Now we don't have those stoplights. Oh, 41. Oh man, stoplights. No more stoplights. Jordan's next. Took a while, but at the same time, it kind of happened in a blink of an eye. Both are simultaneously true. So it was really nice to cut the ribbon. It's open, and mobility is going to be huge, but safety is going to be huge too.
The safety along that corridor is so improved. We talked about it before, but you go back to 2002 in that IRC, and there was only 2 funded, 19, which we forget about, right on the edge of our county there, and then the one at Anderson Lakes. And then you look at Belle Plaine went,
True,
69,
right, yeah,
14,
right. Forget that
41,
one.
Pioneer Trail, and the work at 494. In 18 years, that corridor has been transformed immensely, with no funding really to begin with, except those 2 original projects as part of the ABC program that the commissioner put in place for transportation.
So we had some, big shots from DC, and the senior senator was there, and I think we were talking to her, and I said, hey, different subject, but no cameras, no lights in DC. What's the deal on the vaccine? Like, are we getting someplace on this thing? And she seemed to think, I know there's a lot more talk. She seems to think that it is very close to being a reality. Now, whatever that means to people, that's up to them.
Can I just mention, Mr. Chair? Sorry.
Yes.
You know, Commissioner Ulrich mentioned he had, most of his meetings were whatever. 12 of my 17 were actually in
Oh,
person.
kind of coming
I
back
was
a
looking
little
at
bit.
like, oh my gosh, that's, you know, so we're coming back, and I like going to these meetings. I'm sure a lot of you do. You see people, and you can talk to them afterwards and before, and find out what's going on in their
Yep.
county for real, so
No, I hear ya.
I think that's good. So
Oh,
thank
that's,
you.
I agree with that. So, that concludes my report. So we're gonna look down to the left and County Administrator.
Yeah, just a couple things, Mr. Chairman. The 29th in 2 weeks, you are gonna have a busy day, because we've moved
Oh,
the
yeah.
building tour to 8 in the morning.
That's right.
Based on what happened there. We have multiple items that you're gonna see presented for discussion at the work session. And then you have your second big ribbon cutting of the month, the IRTS, at 1 o'clock in the afternoon, and celebrating the partnership that Pam really talked about today. And then just a reminder, after we adjourn here, you'll need to reconvene quickly for the regional rail to set that levy at 0.
Sounds like great news. Looking to my right, Mr. County Attorney.
We're not getting.
Nice. Look at that. Boom, right to it. All right, well, that brings us to item number 13.
Motion to adjourn.
We've got a motion.
Second.
We've got a second. Any discussion? Otherwise, Deb, I almost grabbed the gavel, but we'll roll call this out.
Commissioner Weckman Brecky.
Aye.
Commissioner Wolf. Commissioner Beard.
Aye.
Commissioner Beer.
Aye.
Commissioner Ulrich.
Aye.
And so before we do gavel out, as was mentioned, immediately following this, we're going to be convening as the Scott County Regional Rail Authority. So with that, we are adjourned.
17 open.
So we just rock and roll.
Rock and roll,
We don't need
call it
to
to order.
do a pledge.
Up that hill
No.
past
We already did a
that.
pledge.
Oh, it
No
should
pledge.
be.
Okay.
Yep.
The gavel called to order.
Should be all opening up.
Because those are like 2 or 3 days ago, it was not open.
Yeah, no, it wasn't there.
All right, we're going to call the September 15th, 2020 Scott County Regional Rail Authority in session. We've already done the pledge based on the board meeting that we just adjourned from. Item number 2, amendments to the agenda. Any amendments? Nope, so they will stand as distributed. How about approving the minutes of the September 17th,
Chair, I'll motion to
2019? We have
approve
a
those minutes.
motion.
Second.
We have a second. Any discussion? Otherwise, Deb?
Commissioner Weckman Brecky.
Aye.
Commissioner Wolf.
Aye.
Commissioner Beard.
Aye.
Commissioner Beer.
Aye.
Commissioner Ulrich.
Aye.
All right, let's move to item number 4, consent agenda. 4.1, only one item, adopt resolution number RRA 2020-001, establishing a final levy of $0 for 2021 for the Scott County Regional Rail Authority for the purpose of inclusion in the proposed property tax statements.
So moved.
Second.
Motion second, any discussion? Not hearing any, let's go to Deb.
Commissioner Weckman Brecky.
Aye.
Commissioner Wolf.
Aye.
Commissioner Beard.
Aye.
Commissioner Beer.
Aye.
Commissioner Ulrich.
Aye.
All right, that is approved. Item number 5, any other business? Not
Motion to
seeing
adjourn.
any. We have a motion.
Second.
We have a second. Any discussion? Otherwise, Deb, take it away.
Commissioner Weckman Brecky.
Aye.
Commissioner Wolf.
Aye.
Commissioner Beard.
Aye.
Commissioner Beer.
Aye.
Commissioner Ulrich.
Aye.
We are adjourned.